Wonderful to see you all. Newly aligned room. The commission has now come back from closed session. We met and no action was taken. I'll now move on to item number 1 and defer to Director Wong to lead our land acknowledgement. Thank you, Director.
Yeah. And I just noted that in the future meeting, we can do a video from Nick, a partner, a native tribe locally. So we acknowledge that this meeting is taking place throughout the unceded territory of California, home to nearly 200 tribal nations. As we begin this commission meeting, we acknowledge and honor the original inhabitants of our various regions. A land acknowledgement is a critical step towards working with Native communities to secure meaningful partnership and inclusion in the stewardship and protection of their cultural resources and homelands. Let's take a moment to honor these ancestral grounds that we are collectively gathered upon and support the resilience and strength that all Indigenous people have shown worldwide. We are currently meeting here from First 5 California in Sacramento, the ancestral homeland of the Nisenan, Maidu, Miwok, and Miwok people, who are the Indigenous peoples of this land and have lived here since time immemorial.
Thank you. Thank you so much. Good morning again, everyone. I appreciate your grace as we go into, and come out of closed session. Joining us here in Sacramento and virtually by Zoom. We have just a few housekeeping items before I turn it over to Director Wong for her report. We are going to move item 7, the public relations campaign. We're going to move it up higher in the agenda at the request of Supervisor Ellenberg, who is going to be a co-presenter on this item. Additionally, members of the public who are attending both in person and virtually will be given an opportunity to have public comment on each item prior to any commission action. This is part of our regular course, but I wanted to make it part of my own announcements going forward. If public comment is not specifically requested, members of the public should feel free to request an opportunity to comment. The total time allocated for public comment may be limited. Comments will be, may be limited up to 3 minutes per person. However, me as the chair may decide to shorten or lengthen the public comment period under my discretion. Members of the public will not be permitted to yield their allotted time to other members of the public to make comments. This is part of our regular posted agenda. I just wanted to have the opportunity to share it with everybody, and I know we have several people who are making public comment today. Before the beginning of each item presentation, we will ask members of the public to use the public comment sign-in sheet and sign in at the podium. Thank you for doing that. Or to raise their hand function for those participating virtually on Zoom. This will allow for effectively allowing all of us to navigate public comment more effectively. Appreciate that. I will now ask our commissioners whether or not we have any conflict of interest. Commissioners, please let me know if any item on the agenda presents or may potentially present a conflict of interest for you. Obtaining this information in advance will ensure that I can announce any non-participation in addition to items in compliance with applicable laws. So commissioners, please let me know if you have any stated conflict of interest on any item. Commissioner Majors, any? No. Okay, thank you so much. Seeing none, I'll now turn it over to Director Wong for her Executive Director report. Thank you, Director.
Great. Thank you so much. Good morning, everybody. Buenos dias. Good to see everybody. Crowded room. For those new people coming in, there is an overflow room. Not sure how many other folks are. So no disrespect if there's lots of people with interest in today's commission meeting, and so there are staff upstairs waiting to greet you. There's also coffee upstairs from a Keurig, but still coffee. I know, sometimes you might want to watch up there. I see that. Next slide, please. Our report will include an overview of the strat plan, the really high level, just a brief update on the First 5 county fiscal playbooks and program updates, personnel updates, and just a review of the commission calendar as requested to kind of drop in the meeting reports and possibly any discussions of changes of what we might want to do with the commission calendar. So next slide, please. So as just a brief overview, I won't kind of read what's already in my written ED report, but we've actually been excited to actually have some strategic focus groups that have engaged folks in response to kind of the desire to have more voices to inform our strat plan. We've been able to meet with the First Five Association as well as various commissions to inform our stat plan. A few of our partners, both in the research field as well as nonprofit CBO early childhood space, to help better inform kind of our strat plan moving forward. Thank you to commissioners for flagging that and making that a priority. So that Arabella has concluded those commission or those focus groups, and we'll be bringing that information back to our executive committee to unpack a little bit more our findings and how to integrate that more fully into our strategic. So next up, please, is I love this. I don't understand football, but I know my staff put this in for me, so it totally confused me. So anyways, the county fiscal playbook that I know Catbird Strategies has met with associations and a few counties about this, as well as the policy center. There's the association, the policy center, and counties. To kind of talk about what opportunities that we may be leaving on the table. I know that we are fine tuning what that looks like, and hopefully we'll be able to kind of talk more in depth and do a full presentation. I'm looking at Alex on it in the future kind of fiscal advisory committee, so people kind of understand what those opportunities are, and really just want to be grateful for those who have been able to inform what that fiscal plan, that fiscal playbook looks like, because what we know is that not all fiscal opportunities are right for every company, just depending on the politics and whatnot. So really excited about what that will look like, and then really working together with others on what makes sense and how do you roll that out. All right, next is the program update. So a couple of things. Funding. I just want to make sure that we were unmuted. So those in our Zoom room was able to hear what we were saying. Thank you, Nisha. So we will have an item later, kind of diving in depth about the status of implementation and new opportunities. Again, our staff are working really, really hard on getting the home visiting reconciled and getting payment back to counties as quickly as possible. So really appreciate your patience with all of that. And the third is, again, I'll just highlight the impact legacy. We are also in deep discussion about what I know everybody's eagerly awaiting what that is. We need to have just some internal conversations about what the end of the impact legacy investments will look like, and more there. I actually really do want to highlight, I don't know if there's a slide on this, of thank you, Amador County, for hosting our staff on a messy morning, but we didn't drop in a picture, did we? Where our program improvement and evaluation staff were able to visit Amador and have a messy morning in community with Amador's partners. Thank you so much for hosting. It really brings alive kind of the work that we're doing and makes real what that looks like. And so really we appreciate you hosting folks. And these are what I call often those mission moments, like the reminder, like we often get caught up in contracting or this, that, the other, decimal points of like budgeting. But really those moments of like mission moments, be able where you can actually be in community, see families, talk to kids, and see the joy has really poured back into our staff in a way that is so meaningful. So thank you so much for hosting that messy morning. And again, I won't go over everything in here, but we have a culturally responsive and equity approach to everything that Dr. Dominguez-Brinkley is leading, and the annual report training and listening sessions, as we know, that can always improve on how we collect data. We would love to actually gather, as in the past, pictures from counties that we want to include again in this year's annual report. Look for a Google Drive soon. It most likely will not be in the AR portal, but if you bear with us, we will send out a Google link and you can upload whatever you believe that, not believe, that you want to capture visually in our report. And so no promises that every single picture is included in the annual report. However, we actually, as internal staff, always love seeing, again, those real life moments actually, even if they don't include in the annual report. And next, please, next slide, please. And we'd like to welcome 3 new people, David Huang to our Contracts and Procurement Office, Barbara Schmidt, who is here, who is our new EGA External Affairs Manager, and Dr. Riedel Fabian, who is online somewhere. I don't know if either I will yield the floor. I know David is not on, but Barbara, I don't know if you want to share a few words while you're here.
Thank you. Glad to be here and delighted to be part of the work that First Five California is doing. My background is in legal and policy issues. I've worked for the state, for other state agencies before, including California Department of Social Services, California Department of Public Health, mostly on policy issues. I also have a history of working on other issues in the private sector that I care deeply about. Delighted to be here, so thank you.
Yeah, thank you so much. Earl, David is not on, correct? Okay, that's okay. I don't know if you want to share a few words, but it's in here. He is a teacher by trade and happened to fall into his passion of contracts and procurement, right, Earl?
Yes, so David, if you are listening, and everyone in the room, welcome. David is starting out his tenure at the state service. He is a former grade school teacher and found the calling to serve in a different way, which is to start First Five. So we're very, very lucky to have him on the contracts and procurement team and look forward to having him work more closely with procurements as well as our partners out in the community. So welcome, David.
Welcome, David. And Dr. Fabian, is he on?
He's online.
Okay, I will invite you if you can elevate Dr.
I think he has to
Fabian.
get permission.
Yep, Simon's doing that right now, so if we can, we will elevate him so he can come on and say hello. Dr. Fabian is our newest research scientist too, helping build out our program and innovation evaluation side. As many of you know, if you've been around a long time, you actually have a larger research evaluation team, and so we're doing that just because we want to become more impact and data centered. So we're excited about that Dr. Domingue Springley is building out that team. Hi, Dr. Fabian.
Can you hear me?
And I don't know if you want to come on camera, but we absolutely can hear you.
Awesome. Sounds great. I'm not sure if my camera, I think I have to get permission to turn my camera on as well. But that's fine. Just a little bit about myself. Dr. Fabian, I have a background in public health. Actually, I was actually raised in Central Valley, but and I did my program at UC Merced as well, so in public health. And I do have experience when it comes to behavioral health and health economics as well. So I'm currently focusing on initiatives that connect literacy with early childhood development, particularly in relation to ACEs in behavioral health. I'm very happy to join the department, and I look forward to collaborating with each of you to create impactful solutions for our community.
Thank you, Dr. Fabian. And he's from the Central Valley, you all.
Yay.
Not that we're us from the Central Valley are biased, but there's an element there. We are also still in the middle of trying to hire three more posted positions: a research scientist, too, a chief counsel, and a manager for our administration governance office. So come back for a position. Next, we have just a quick review of the commission calendar. I won't go in depth, but this was a little bit of just putting it in the ED report to see if there are any changes or any desires to kind of provide feedback for the commission calendar. And this isn't necessarily something that we adopted, but just a general what the executive committee and I talked about, like what we were thinking we should be doing at each of these quarterly. Any questions? Okay.
Any questions online?
And we have to comment on the site, should we do it now or?
Could you wait until we get through all of the reports and then we can come back? Thanks so much, appreciate it. But we'll note that that is there. I will now turn it over to Ava McPhajian for the First Five Associations Executive Director Report. Thank you so much.
Thank you, Chair Albright, Commissioners, Director Wong. Good morning, everyone. Avo MacDessian with the First Five Association. I just had a, excuse me, a couple of quick updates I wanted to share on behalf of the association. And one, just personal story about a visit. Speaking of visits, Jackie, about a mission moment for me last week. Quick updates. Thank you for mentioning the First Five California strategic planning process going on right now. We had a great meeting with Farabella Advisors a couple of weeks ago, and really good hard questions that were asking us, and as well as the counties, and a really great dialogue there. So appreciate the commission uplifting and prioritizing those conversations. I'm hoping our feedback is uplifted in future conversations. The second update I wanted to share was we're celebrating 1 year of the Medi-Cal learning community being online. And that learning community, as a reminder, is funded in part by the home visiting coordination grants from First Five California. And the purpose of the learning community is to support First Five counties throughout the state to better understand Medi-Cal, how to draw down and partner with all the changes that are happening right now in Medi-Cal, and in fact become supervising providers and local hubs for implementation of Medi-Cal programs. And so we are 1 year in. We have a number of counties that have already been approved by the state to be supervising providers for a variety of new funding streams. So we're really grateful, and we've got another year to go with this learning community. At least we'll see where it goes from here. And then the last update I wanted to share was, as I mentioned, a local county experience. So over the last couple of weeks, I've been doing a lot of traveling across the state, in the Bay Area especially, and then most recently up to the northwest of the state. And one of the themes that continues to arise during these meetings with community partners and First Fives is the deep and real feelings that are being felt by immigrant and undocumented communities throughout the state, particularly with uncertainty around the federal election and those fears, manifesting with ideas of deportation and family separation and just general unrest after the election. And so what that uncertainty of the election has been raising is anxiety levels with parents and caregivers, obviously. And as we all know, that when adults feel worried, children feel worried as well. And last week I was in Humboldt County. Shout out to Marianne Hansen and her wonderful staff for hosting us. And we met with their staff, and those anxieties were definitely being felt in Humboldt County. And one of Humboldt's family navigators, Leticia, shared with me this red folder. If you're all familiar with the red folder, basically it's a list of family resources for times of stress and how to navigate those times of stress. And the materials put together by First Five Humboldt, but collaborating with local organizations. And so due to some of this election anxiety I've been talking about, these continued years of deportation and family separation, this family navigator is meeting with families in some of the far reaches of our state, talking to them about the resources available to them. When you open up this red folder, one of the first pages in there is how to talk to your children about political concerns. That's the first item. The second item is a family preparedness plan from the Immigrant Legal Resource Center. If you all have seen what a family preparedness plan looks like, basically it's preparing to be separated from your family, right? who's gonna take care of your child, who's gonna be the guardian for your children. God forbid someone comes knocking at the door. I thought about my own family at that moment, and if I could fill out such a plan or even plan for a separation like that. And I couldn't bear thinking about it, and I know many of us can't either. But what it reminded me of is the hard, relevant, and timely work that's happening throughout the state every single day. And so when we talk about systems change and policy change and federal elections, we need that. And at the same time, I just want to recognize that there's hard work happening every single day in our communities. And the connection to the First Five California Commission here is one where I want to make a point about this is the hard work and the connections in the community with trusted partners that can only amplify the work happening at this commission. And so I just want to reiterate as an example of what I just saw, witnessed, and talked about last week. And a lot of the, media, statewide media campaigns that are going to be happening and rolling out soon and are rolling out soon. And the power when those two work streams come together, the power of impact, the power of answering the call to what families are feeling right now viscerally, is that potential is amazing. So I just wanted to emphasize that, connect it to a mission moment, as you said, Jackie, for me just last week, and some of the discussions that are going to be taking place today. That's my update. Thank you.
Thank you so much. Any commissioners, comments, questions on this?
I was just gonna say the red folder, is that being shared with other counties? Is that like seen as a best practice now? Because I just see it as a very good resource for other communities.
Yeah, many counties do have their own versions. The association just sent out a few new resources leading up to the election. And I'm not sure exactly how each community is using it, but we have many of the members here that can speak to that. We're trying to spread the word.
Thank you so much.
Yeah, I mean, I simply that it, I think an important reminder, we often grapple with, the slowness with which, we're able to operate. And so, the fact that we have partners who can be nimble, who can be responsive. I know, in my other work, in the, TK-12 space, but we're thinking how do we partner with those trusted messengers? So really appreciate the work. And the reminder that to the extent possible, through our communication channels, through media, that we can really think about what California families need today and what support they need. But I think there's always a tension because we can't do it as fast as you can. So really appreciate the work.
Sure.
I want to extend my appreciation as well, having worked in a family resource center that had those very, very difficult conversations around family planning in terms of separation. I just wholeheartedly extend gratitude to you and every member of the community who's doing that, because it is vital work, and agree on the partnership and alignment in terms of how we can think about California children. I also very much wanted to appreciate the work that's happening with revenue maximization in terms of Medi-Cal. Hope that you look at CMA funding, county Medicaid administrative activities funding as an opportunity to support both family resource centers and bioscience as well. So, yeah,
Thank you.
I appreciate the work you do.
Appreciate it. Thank you.
We will take public comment now on this item. I will say we will do it until 11 o'clock because Supervisor, because of a request of scheduling, we will end public comment on this item at 11 o'clock and begin the next item. Thank you.
Thank you. Courtney Armstrong with the First Five Association, and I'll go, it's hard to follow, but I'm trying to step back and talk about Medi-Cal. So I don't know if this is an appropriate time to make this comment. It might be more appropriate. It's regarding the playbook, the county playbook that we're anxiously awaiting from Ms. Sunderling. And I know that will be presented at a fiscal committee, and I'm not sure if there's opportunity for public involvement in that. So I just wanted to share a few things that we talked with Ms. Sunderling about for your information. And so when that comes out, at least you have some of the background from our perspective. And really thank you for the opportunity to work with Ms. Sunderling. We were excited that she was involved. She has such this deep system of knowledge, and that's a real great resource for the counties, and we hope for the state. I just wanted to flag that, you know, it's hard to speak without seeing it, but I just wanted to flag that maybe the reach of counties that she was able to talk to, at least based on our most recent conversation, wasn't quite as broad as we would have hoped. And so that might also inform like the ability of some counties, especially some of our smaller counties, to do some of the work that she's suggesting. But also wanted to highlight that the work that Abba mentioned of the Medi-Cal learning community that's been doing really deep Medi-Cal engagement with 56 of our 58 counties, I think, for the last more than a year, but at least for the last year, and really the partnership of Perspective California for that work. We did prepare a report for DHCF. I woke up this morning at 4 a.m. and realized we have not shared that with you all. So I printed it out. I can share that. It's just a memo that outlines a lot of the work that's going on across the counties that I thought might be of interest. And then also would just highlight that I think this is, as I said, a good example of county and state partnership, and that we're hopeful that this playbook that comes out will not just be aimed at counties, but that could also highlight places where Perspective California could step in and be partners to counties in this work. And it kind of ties into our stabilization conversation. It ties into a lot of different things we've been talking about, but wasn't sure where to make that comment, so I had to do it now. So I can hand this out in a bit because I have to collate it, but I just wanted to give a little preface for that.
Can you also email us?
Yes, we'll do that.
And on that, echoing that, we are getting a lot of communications. We want to make sure that they're streamlined so that everyone is aware of the communication. So actually, Simon, if you could let us know what the email address is, that would be great. And
Yeah, I'll get it after lunch.
Okay.
I just want to make sure it's right. But that will be,
Info one.
I'm sorry,
Is it the info one?
it won't be, actually, it's gonna come to our governance office.
Okay,
Yeah,
so
I just want to
maybe-
get it right. I'll post it, I'll put it up, I'll make sure everyone has it before the, yeah.
And
So
this is
what I'll
all
do is-
communications that is
Yeah.
going to the commission will go to this email address.
Okay, yeah, so I will email this to you all after lunch.
Yep.
Thank you.
Thank you so much.
We have one public comment on Zoom.
Perfect. Were you making public comment?
I was going to. Please, hi. Anna Bauer, First by Butte County. I just wanted to share some information about impact in Butte County. Those dollars pass directly to the County Office of Education, and they do amazing work. And their timeline for understanding what their future funding is and retaining staff in January, as you probably know, county offices of ed and other educational institutions have to start identifying which staff will be laid off, and then by March, they're going to be issuing those pink slips. And so just to have that sort of situational awareness for those of us that work with our COEs for impact. Thank you.
Thank you. So that ends item number 1. We have, I think we'll be able to do item number 2, which is public comment. Members of the public may speak. There's
Dan Berman with his hand up.
I'm not sure if he wanted item 1 or 2. There's.
Mr. Berman, are you?
Item 2, please. Thank you.
Very much. So I'll call that item. Any item, anyone else on item number 1?
And Doug Major.
Mr. Major, are you on item number 1 or number 2?
I'm on number 2, please, public comment.
Okay, thank you so much. Item 2, public comment. Members of the public may speak up to 3 minutes on any non-agendized items or items relating to pending judicial, administrative litigation or personnel matters. No action by the state commission may be taken on this public item. If you wish to comment, use the hand function. Simon will call on public in the order in which they are signed up, starting with those in the room in Sacramento and then those in the virtual queue. I don't believe that, are there any Any members of the public in the room that wish to speak? Okay, thank you. We have two members from the public who are on the phone. Please, Simon will call you.
Doug Major.
Hello, everyone. Doug Major, eye doctor in San Luis Obispo County, representing the SL Alliance as well as the California Children's Vision Now Commission. Just want to give you a little boots in the ground experience as someone that goes and sees children every week. There is a demographic shift that's going on in our state. A lot of these children now have visual issues that were not present maybe 20 years ago. Again, I was involved with Rob Reiner, Huffington, way back in the Prop 10 era. So I've been doing this for a lot of years. Just want to let you be aware. These children need to have more visual, access to vision care. And there's very few people advocating for them. I was hoping that First Five might do this for you. I don't know if you're aware, according to Children's Now report, we are the 51st in the nation. We are the 51st in the nation for access for children's vision care. This affects literacy the first day of school. What hurts me the most is when I see children entering school without the tools to learn. They don't have a chance the very first day. It's not our state. I think it's just because it's been invisible. I'm hoping that the First Five will go ahead and put this as a priority to the Department of Healthcare Services, that they change some of their policy. They have no metrics to survey this. Also, these are children that have a special type of change. They are Native American children or children with Native American blood, or Mixteca, wonderful children. They have a type of condition that affects their vision, slows their reading according to research by half. This is your ballpark. Literacy, health before age 5. I'm hoping that you would join with us and be a part of this. And just a shout out to Commissioner Jimenez. I'll be going to South Monterey County. I just have to believe that if you see this face to face with these children, there will be change that happens. Thank you so much for your work, commissioners. First Five is where it's going to happen, this change. Best wishes.
Thank you very much. Next speaker.
Dan Berman.
Yeah, this is Dan Berman from McKinleyville, California, up in Humboldt County. I had a request that you guys include on your website your current budget, financial statements, and maybe your most recent audit. I was trying to find some of those materials. I was able to find some of them by going through attachments to previous meetings, but there was not a section that I could find on the website that just had them accessible to the public. So that's my comment. Thank you.
Francine Rod.
Good morning, commissioners. It's Francine Rod here with First Five Monterey County. Thank you so much for all of your work and support, and to all of my colleagues in the room there, good day. I just wanted to, I know there's been a lot of change. I've been with First Five now for, I don't even want to tell you how many years, but there's been a lot of change in terms of the commission and in terms of the staff and in terms of at the county level as well. And one of the things I really want to help to support as we move forward and think about all of these various initiatives that are happening before us is a way of collaborating from the beginning as we're starting to think about and plan for them, because of the things that you all were talking about, the great knowledge that has been developed in the counties over the years for how to be able to support the children and impact them in the most impactful ways. And we recognize the strength of all of the great staff that you all have at First Five California too, and the new folks coming on board. I want to really welcome them. What we used to do is we used to have groups, like work groups, where it was made up of county commissions as well as state staff, as well as First Five Association staff, as we grappled with various topics. One that's coming up, I know we talked about impact unpack a little bit, that's one that could really use some real deep dive with the counties to really help design what's going to make the most sense moving forward, as well as the kit for new parents. That's one that we really are kind of concerned about in our county, and I know in our region, because we really do use it as a mechanism to reach families who have been put at risk the most, who don't have access to technology, to maybe download or to be able to access things. They need things on paper. And that helps us bring folks into the fold and into the work that we do. So we'd love to work with you as you're designing the next steps related to that from the beginning to help more with the design, the implementation, and the evaluation of it. And hope that you'll reach out to us to be part of that discussion as it moves forward. So thank you again for the work. We look forward to collaborating even more strongly in the future.
Thank you very much. Any other member of the public?
No.
No, seeing none, thank you very much. That closes item number 2, public comment. We will now move on to item number 7, indicating that we were taking our items out of agenda. Out of order because of a request from Supervisor Ellenberg, who I see. Thank you so much for joining us today. I will now call item number 7, the public relations campaign. This is an action item. I would like to welcome the Public Education and Outreach Advisory Committee, which includes Commissioners Jackie Majors and Amy Bernardino Fabi. Thank you both so much to provide their report out, as well as Dr. Angela Williams from First Five, our Chief Deputy Director, to present the public relations campaign item. Thank you all so much.
Thank you so much. I really appreciate the invitation to be here today. I am the president of the Board of Supervisors for Santa Clara County. I am also for 6 years, very happy First Five commissioner. And what I'm doing today is presenting on a project that I started about 1.5 years ago to shift the narrative around childcare from one of largely individual parental responsibility to a public good, to really an economic necessity. And the reason that I'm presenting it today is because you have on your agenda for consideration essentially this type of project on steroids. So I want to share with you the way we have rolled out Build the Future, hopefully give you some things to think about as you look at your own PR item today. So let's go to the next slide, please. So here's where we started. The Council for New America at the end of 2022, beginning of 2023, put out a study that shows in great economic detail that the US economy loses about $122 billion a year in lost wages, worker productivity, retention, rehiring, social services, a whole range of costs related to the absence of a cohesive, affordable, basically universally accessible childcare measure. So we thought, how do we start to talk about this with the folks that don't already understand the vital importance of childcare? The audience for this project was not First Fives or childcare advocates, frankly. It is the business community. It is the non-parent community. I often say when I'm talking about this that we need people who don't have children and people who don't like children to still understand that accessible childcare is a public good that benefits everybody. Next slide, please. So the solution to the economic problem is a fully accessible quality childcare program. How we get there is where we wanted to remain initially agnostic, because the pathway can take lots of different directions. And the feeling was, if we went into this project telling people this is exactly how we get to universally accessible childcare, before we had really softened the ground and had people understand that this was an issue that impacted their economy, frankly, we were just afraid of being shut down. So being a little bit agnostic in the pathway of how we get to accessible childcare has actually opened up a lot of conversations, particularly with the business community, about what this looks like. Is it a public-private partnership? Is it a revenue measure? Is it some other kind of structure? Next slide, please. So the way we've gone about creating and elevating this conversation is through a number of pathways. One has been through community events. Early last year, Applied Materials hosted a symposium for business owners in the region. We were hosted by Applied Materials. Accenture provided the facilitation services, and we had 3 panel discussions with Chamber of Commerce folks, business folks. We had a Berkeley economist, Anna Powell, who I highly recommend to all of you, who can talk about kind of the labor impact and challenges around the childcare workforce. That stimulated a lot of conversation. We had people at the end talk about how they would like to be further involved, both in the specific Build the Future project, but also more broadly in thinking about childcare systems. We hosted 2 film screenings. The first one was Clarissa's Battle, which is the documentary about Alameda County's path to a childcare revenue measure. And we also hosted another documentary called Make a Circle, which is really about family-based childcare, home-based, and what their challenges and direction are going into the future. Both of those film screenings were followed by panel discussions, again, expanding the conversation. We did a fun event recently called Dads for Build the Future, where we wanted to elevate male voices. We want to make sure that as much as women are the most directly impacted by the lack of childcare, we need to make damn clear that this is not a women's issue. This is an economic issue. So by elevating dads and talking about dads' experiences, we awarded and recognized fathers from one who is a CalWorks family and receives childcare access through an entitlement program, to a doctor at Stanford who talked about the challenges that he has had despite being able to afford childcare in actually finding accessible childcare and available slots. We've tabled at a whole bunch of events. We've spoken at community colleges and are trying to be everywhere in our community. Next slide. I'm sharing this with you for a couple of reasons. One, these are folks that have funded or provided some level of support for Build the Future, but it's also significant to me for you to see the variety. We have companies, some of whom are direct providers of childcare. Genentech, NASA Ames, Stanford University have for decades provided on-site childcare. They were included in our panelists, in fact, in talking about the importance of childcare when we met at Applied Materials. We have private childcare providers, Action Day and Building Kids. We have nonprofit organizations. We have foundations as funders. We have labor organizations, and our goal really was to cast a very wide net. It helps us build our credibility to say, these are all the entities today that believe in childcare as a public good. Next slide, please. Another action that we've undertaken was that we have asked each of our cities, there are 15 cities in Santa Clara County, to pass resolutions indicating their support for publicly funded childcare, and specifically indicating why childcare is a city issue, because the narrative, of course, was cities don't provide childcare. Cool, we're not asking cities to provide childcare. Cities do economic development. Cities support small businesses, which is what every childcare provider is, center-based or home-based. Cities must attract and retain young families if they're going to thrive. So for all of these reasons, we want all of our cities to make that declaration along with our county. So we're 2/3 of the way there. We've got 5 cities to go. We are well on track. I'm hoping by February of 2025, we'll do a big presser around every city in Santa Clara County supporting childcare. Next slide. Let me just talk for a minute about funding because, of course, nothing happens for free. I know you've got a budget ask in front of the commission today. We have raised from public and private partners just over $500,000. That primarily went to startup costs. We had to design a website, we had a logo, we had to create social media, create a strategy. So we had some employed consultants and project managers for us. Now at this stage, we have moved into working partnerships essentially as our fiscal sponsor and as our backbone of the work. And the costs right now are largely in digital media. Let's go to the next slide. We have a combination of professional videos, and I'm highlighting 4 for you here too, to show you that we are really going after the, maybe unexpected advocates. Joe Lopez is a small business owner. She owns 2 restaurants. Her video talks about the challenges of last minute shift cancellations, challenges with employees who don't have access to childcare. Bob Johnson is our county sheriff who talks about public safety being directly impacted by access to childcare. Of course, working families are who you would expect. Our last speaker, our last video up here is an older resident, never had children, talks about why this is relevant to him. We've also done a bunch of homegrown videos. We had a bunch of dads do their own iPhone videos to say why childcare is important to them. We're working now with labor partners to talk about childcare, and we'll go to another stakeholder group after that. Next slide, please. This is some of our social media impact over the last year. We've got the videos, we're on Facebook and Instagram. We don't really do much on other channels, and that's more about just bandwidth of the people that we have doing the social media work. But I'm pretty proud of these numbers for a pretty scrappy little project. The next slide. I would love for you to join us. Here's a QR code. Find our Facebook and Instagram, follow us, share the information. I'm hoping, of course, that Raise California Strong takes off. There are opportunities for cross-promotion. This is perhaps a template for an individual county effort, but truly the more we can elevate this conversation at the state level, the more likely we will be ultimately to identify some revenue measure, both for publicly funded accessible childcare and for First 5. I think we have to talk about these in conjunction. My fear is if we talk about them separately and we do one before the other, folks will say, well, we've already done this, because too many people conflate First 5 with childcare. And while there's a lot of overlap, and obviously the population overlaps, there are parallel purposes. So we really have to make sure that we are talking about both. I have just a couple more slides because I had the opportunity to be here. So I just wanted very briefly to share a few exciting things that are going on both in our county and in partnership with First 5 Santa Clara County. Next slide. So we created a couple of years ago the Office of Children and Families Policy. One of their primary functions has been to look at how we expand access to childcare. We've deeply partnered with First 5 and the County Office of Education. So those are just a couple of highlights of things that we're doing at our county. Next slide. One action that I really want to point out, because it is in deep partnership with First 5, is that we've used ARPA funds, $15 million in grants to reopen, expand, or create new childcare facilities. We had applications that exceeded that $15 by a good 800, 900%, indicating how significant the need is. So we will look for more funding. We've also created an apprenticeship. Well, we funded, First 5 has created an apprenticeship program that pays students to participate, that provides childcare, and that brings people to that next level of professionalism and helps them get placed. As I know all of you know, this isn't the primary audience. We need to expand facilities, we need to expand access to slots, and we need to expand our workforce. Last slide. This is just a last piece that I wanted to share, and I actually don't know and would love to learn more from First Five California as to whether or how you are engaged with Black Infant Health and the Perinatal Equity Initiative. We're doing a lot in our county. That's work that's very important to me as well. So that is a quick snapshot of the work that we are doing in Santa Clara County and with Build the Future. I am really excited about this campaign. I'm also so deeply committed to working with the First Five Association, with First Five California, and with CSAC. I didn't mention in all of my hats at the beginning that I'm also an officer for the California State Association of Counties. We have a child care working group. We are not looking to get out ahead of you all, but we want to play a part where we can be useful in elevating this conversation, both about ongoing non-diminishing funding for First Five, and how we can talk about that access to childcare. So I am here with so many hats to be a partner, and if your schedule permits, I would love to answer any questions. That's all with the slides. Thanks.
Well, thank you so much for your time. We know that's limited and really just, it's really special to have you join us, even from afar. And hopefully next time we see each other, it will be in person. So
I would love that too.
Grateful that you're championing this issue. And so I know you might subtly drop off, but at this moment, I'm going to hand it over to Commissioner Majors and Commissioner Bobby to update, provide just the update on the meetings, as well as then turn it over to staff for, I know that they have a few more slides.
Great. And I'll just note quickly, I'm happy to stay on until 11:30. And if anyone wants to reach me after I have left, you can certainly look up the supervisor account. But it's also susan.ellenberg@bos.sccgov.org. Thanks.
Thank you for being such a champion, a great partner for us.
Thank you, Dr. Wong, and thank you, Supervisor. I loved hearing a lot of the work that you are championing. We do not have enough champions in this work, so I really appreciated hearing a lot of what you had to say. First, Dads for Building the Future. I think that's incredible, really aligns with some of the work our staff will be talking about momentarily, but also just the simple message that I believe that you conveyed, which is this is not just a mother's problem. And again, not highlighting childcare as a problem, although access to it can be, but really bringing the entire village into the art and the role of caring for California's children is so important. So thank you so much for participating. I will just say this, as we think about the work that we've done in our committee, we had the opportunity to hear from staff a lot more about not only the campaign that we've been launching, but again, more data around why it is so critical and why it's so now. The supervisor also mentioned, which I really appreciate, there's lots of overlap in this work. It's good overlap. It's important. The problem is significant enough where our efforts, although the importance of it being aligned is critical, the overlap and the parallel purposes, I think, benefit our outcome. I also wanted to highlight Avo's opening comments, which I really felt inspired by as we think about not only the red folder and the resources, but the family plan that you mentioned, Avo. I mean, that actually gave me chills as I had to think about what kind of plans I would make for my family if I had to think about separating. As we go into this item 7 and think about the importance of our role as community caregivers of our youngest California citizens, the importance, as the supervisor really just underscored for us, of childcare, We learned a lot in our last meeting, really around just some of the additional work that we're doing in the campaign, the Raising California Strong campaign, Stronger Starts campaign, and all the different work related to making sure California is fully versed and really understands not only the importance of everyone's role, but the different work that we have to do in terms of getting California to continue to increase our investments in childcare. Favi, do you have anything you'd like to add?
Commissioner Poppy, yes.
No, I'm fine. Thank you so much for summarizing everything. Sounds
Okay.
great.
Great, and so I'll turn it back to staff.
All right, so Dr. Williams, we will continue on. Unless there's a question from the presentation from Santa Clara, but I know that, again, Supervisor Ellenberg's time is limited, so if Commissioner have any questions about.
I have one question, Supervisor Ellenberg. Can you explain NASA's involvement and why they came to this?
Yes, I would love to, and they would love to even more. NASA Ames on the peninsula in Santa Clara County has been providing on-site childcare for more than 30 years. And they do this obviously because it's a business decision for them. It's a positive investment, and Genentech and other companies that do this will tell you the same thing, that it has helped them attract and retain employees. In fact, the director now of one of the projects there, his kids have gone through the program, and now a second generation is starting. So what I want to make clear is I'm not viewing employer-based childcare as endgame. It's not equitable. We know who has access and who doesn't have access, and also people change jobs, and we've seen that employer-based healthcare has not been such a hot solution to healthcare access. But nonetheless, I am highlighting businesses that do provide childcare because it's an example of why childcare is important to the business model. If they are investing in it, if they are providing it, then clearly it is not because they are just feeling warm and fluffy, but because it helps them retain employees. There are fewer missed work days. There's greater retention. Less turnover means less expense in doing that. Cisco and Google, on the other hand, have cut back, have closed some of their childcare facilities since the pandemic because more workers are remote. And to me, that reflects a real limitation in their thinking, because even if their employees are working from home, they still need childcare. They just may need it now closer to where they live as opposed to at work. The notion that, we all figured out during the pandemic that working from home and childcare are not simultaneously successful endeavors. The other point that I'll make about that is that there are companies that provide childcare benefits, and the county is one of them. That is certainly, again, better than not doing it. But a company that says they provide benefits is not necessarily providing childcare, because, again, if there are no accessible or affordable slots, that money that you're holding, those pre-tax dollars, don't actually ensure that you have childcare. So even companies that are providing benefits have a vested interest in there being sufficient facilities and workforce. So businesses are part of the solution, but they are not endgame.
Thank you so much. You got a lot of acknowledgement around your comments during some of them. We're hearing things here. Any other comments? Yes.
Yeah, and I guess it's just a clarifying question around when you say childcare. Do you mean specifically for our youngest children? Are you focused in Santa Clara on babies up until sort of elementary school age, or are you thinking more broadly and curious around if and how you're engaging school districts?
Yeah. So that's a great question. So when I'm talking about this access, I am not talking about after school or before school. And it's interesting now with the expansion of universal TK and pre-K and the extended day obligations for K-6 schools, I believe, to provide those enrichment hours. I think there are other funding sources and other opportunities to kind of patch that. I had initially, before universal TK was rolled out, we had been thinking more about 0 to 5. Now the focus is really 0 to 2. And I know that particularly for home-based childcare providers and for parents that need full day care, a 3-hour preschool is not sufficient, and even a 4 or 5 hour transitional kindergarten isn't sufficient. So there's still going to be a big demand for 3s and 4s whose parents need that full day coverage. So I'm really thinking about that full day outside of the school system. I think once kids are in a state preschool or a state pre-kindergarten program, there are other sources that will step in and patch that.
Thank you. Thank you so much. As we think about allies, the military, that's why I asked about NAFTA, has been a big supporter of childcare. Secretary General Colin Powell, now passed, was poignant in his advocacy for childcare. So appreciate that.
I love that. And I'll just say that just in talking about companies and federal impact, you probably all know this as well, that about a year ago, President Biden passed in the CHIPS Act requires now that semiconductor manufacturers provide childcare. We've got a lot in Silicon Valley. Applied is probably the largest, and there's some stickiness now about what that actually means to provide childcare, whether it's sufficient to provide a benefit or whether they need to ensure that their employees that need childcare actually have available slots. There's not an answer to that yet, but there should be one coming. And there are, Ro Khanna has a bill to expand access to childcare. Adam Schiff has a bill to modernize Head Start. Seems like there are little patches everywhere, but in the meantime, we're still struggling here. We don't have enough full day programs for the children that need them. And until somebody else gets on this, it's us. We are the ones that need to create these solutions and see that they're funded.
Thank you very much. I'll turn it back to Director Wong.
So thank you again for your time. I know we have you for 3 more minutes, but really highlighting the value of amplification. The locals have, like you have been champions for a while, that this investment makes a difference from a statewide perspective. So, and again, grateful for that acknowledgement and that future partnership of amplification of everybody's local campaigns, and just highlighting the missing part markets, right? Those who are, we're not necessarily speaking to the choir, the people who are actually already in the room. We are speaking to new folks, to your point, who may not have children, may not like children, right? Like that comment, and really working together on that message.
Thanks so much. And Build the Future, for those of you who I hope include all of you want to check that out and follow our things. It's Build the Future SCC. Thank you again so much.
I'm going to hand it over to staff. So Dr. Williams, I know, and Simon, we have some slides and we have including. Yes, we have 30 minutes, including public comment. So I know that we've gone over some of this before, so maybe take about 10, 15 minutes on staff slides.
I'm gonna try to lay it out. It may take me more than 10 minutes, but I'll try to be brief. The thing I want to start with is really looking at the ask, because the ask is not just for the public relations campaign for Raise California Strong. That is one of 7 priorities related to this $4 million ask from the commission. I will go into detail about what those other items are, but obviously the most important is the public relations campaign known as Raise California Strong. I do want to mention that there's already a website up. There's already a report up. It has been socialized, and we actually had a press conference. Some of those folks, advocates that are in the room here, who will probably speak during public comment, came in support of that. Assemblymember Corey Jackson spoke on behalf and in support of childcare affordability. Senator Nancy Skinner, Assemblymember Aguiar Curry also sent their support at the press conference. Representatives from Child Action, Children Now, as well as many others. Also, one of the things that we've been doing is an ACEs forum. Our executive director, Wong, has organized an ACEs forum where folks from around the state come together to talk about the most pressing issues that leverage into that nexus between ACEs and. So many of the conversations there are about the nexus between ACEs and childcare. So the Child Care Resources Center, Capital Impact, California Coalition for Children and Safety in Child Poverty, and the Office of Policy and Planning at the California Department of Public Health. Again, supporters of this idea that we should focus on the issue of childcare. Next slide, please. Just to highlight, again, next one. That one. And one more. Just to highlight what we're going to be talking about briefly, right? This campaign is data informed and priority focused. And what do we mean by that? We mean that First Out California, under the direction of Director Wong, has started this campaign with data, with actual conversations and data with the public around this issue. And one of the things, again, I'll be rolling through the data pretty quickly. That's why I'm trying to give you a kind of a container to view it and hear it in, is exactly what Supervisor Ellenberg said. It is the unexpected advocates, those in business, those in other places, that may know the challenge, but not fully understand the impact of that type of investment. And so, again, just reiterating, one of the reasons why it's solution agnostic is because we're trying to build a collective impact orientation, focusing on those unexpected advocates along with others in the 58 counties that already have, as Supervisor Ellenberg presented, their own childcare campaigns, their own childcare working groups. It's the basic notion of agenda setting and public will building. Next slide, please. So you are now looking at a slide. This is taken from Strata Research, a third-party evaluator who conducted a survey in September of 2022 with California caregivers of children 0 to 5 with at least one or more ACE and family income under $75,000 to inform how the First 5 California PR campaign priorities can support parents, caregivers, and advance the North Star and the audacious goal. Why is that important? One, because it's 2024. So we've been on this for some time collecting data. Our first move in any kind of campaign like this is to get data directly from the public, from the folks that actually enacted Prop 10, from the taxpayers, from the people that see the situation on the ground. One data point. 51%, the vast majority, selected childcare affordability as the most important item for them. Some qualitative data for you. Childcare is a key concern for many parents of young children, and First 5 could support childcare for California families. Which of the following issues is important to you? So when we say that this campaign is prioritized, we didn't just ask, well, what can be done? We asked, what can First 5 California do? And the focus is on child care affordability. Next slide, please. Oh, all right. Another point of fact related to the Strata research, parents and caregivers with higher ACEs confirm the importance of accessible childcare. Those with higher levels of ACEs more apt to select the statement, there's not enough affordable childcare, but in order to work, parents need to access the childcare that meets their needs than those with lower levels of ACEs. Why is this important? Because that nexus between the North Star and the audacious goal is organized towards ACEs. And so the folks that we're trying to actually impact the most based upon the North Star and the audacious goal are those that have been affected by adverse childhood experiences. So in research, usually you try to make a funnel. You go narrow and narrow and narrow, until you can get to the exact population with the exact question that you can have some actionable data. Next slide, please. From the formative research, particularly focused on childcare pain points related to business owners, those childcare pain points fell into two categories for business owners: a lack of awareness and unrelatability. I really love how the supervisor framed it, right? Because you don't necessarily have to care about children to care about the economy. But what if caring about children could enhance the economy? And most of the business owners, that's when their eyes open. They said, well, talk about that. And we've had that intervening reality of COVID, which, again, business owners are trying everything to get folks back. And when we talk to them about this notion of childcare being one of those ways, again, another level of, okay, well, tell me more. That's important because they're one of the missing links. Okay, another data point: broad public awareness and support from business communities improves understanding, adds urgency, and helps elevate the issue to a state priority. So we're not focusing on the folks that are already aware. We're focused on folks that are not aware or less aware or do not see it as a priority. So the focused audiences for Raise California Strong are business leaders, the general public, the media, state leaders, and county and local government. Next slide, please. This is just more data. I can skip this one. This one is more data. Next slide. More data around the formative research. I really want to get to the findings because I recognize our limited time. So as it relates to the findings on affordability, 48% of California parents say it's difficult or very difficult. All of these slides focus on key issues of affordability, access, stability, and economic impact. Next slide, please.
I think we're a slide behind right now.
Oh, next one. Yeah. No, I think we're good.
Okay.
Thank you. I appreciate it.
I'm on key findings from the
Yeah.
report. Is that what you?
Next one.
Okay, next one, sorry.
Yeah, just trying to make sure we stay on top. Another takeaway, right? There are lots of takeaways in this, but I want to leave you with this one. After seeing the average wage of childcare workers, 66% of parents support increasing state investments to improve wages. After seeing how childcare could boost the U.S. economy by $1 billion over 10 years, 58% of the business owners support increased investment. This is a public will-building campaign, which has particular areas of strategy: will building, branding, influence, communications tools, strategy, and the ability to expand and sustain those messages. Next slide, please. So you're seeing some visuals around, one more. Seeing some visuals around the campaign. Next slide. Perfect. So the campaign goal: to increase public interest in solving California's childcare crisis. Again, back to those unexpected advocates. Strategy: a solution agnostic public education campaign to build both broad public urgency as well as support. That urgency is probably the most important point of fact to linger on, because it's not so much that people don't know, they don't understand the urgency, and the campaign is focused on lifting up that urgency, again, to those unexpected advocates. Next slide, please. The tactics. These are important, and again, I won't linger on them for long, but what's important to recognize is that they're both current and future tactics. First and foremost, in current, compelling fact-based content to advance the public conversation and build urgency. This is what the Raise California Strong website does right now. One, from the future: host live events, roundtables, discussions, webinars, outreach. All of that is related to the ask today. Next slide, please. Some examples of what's on Raise California Strong right now. Again, these are meant for those unexpected advocates and audience. Just to read one: 93% of Californians can't afford childcare. And on the far right, the secrets of business success: childcare. We're trying to captivate those unexpected advocates to join the conversation. Next slide, please. Just to mention again, in the media, we held a press conference at the California State Legislature. Assembly Member Jackson spoke in on behalf obviously himself as the budget chair, and also someone deeply interested in social services. We got some great coverage from KQED, from KCRA, from LA List. Next slide, please. Also, in partnership, we've been having conversations with the ECE Coalition. Thank you. From the ECE Coalition and also with CSAC, we met with their executive board as well. They invited Director Wong to present at their annual conference on the 19th. Again, these are more tools related to the campaign: insights, reports, and advocacy tools, partner messaging tooling, and educational websites. Next slide. And so the ask today, this will take about 30 seconds, includes this. Next slide, but also go down 2, 3 more.
Can you just go back to make sure we see that,
Sure, which one?
this one?
Oh, sure.
Okay.
You want to stay on this for a minute?
Yes.
So the next steps, we have launched the Raise California strong.com website. We have published the research report online. We have launched and engaged on Raise California Strong in social media accounts, also held a press conference. We continue to engage with key partners, including the EC Coalition and CSAC, providing partners with digital toolkits to be able to promote the campaign with their audiences. And now we are here at the commission to fund continued investments to advance the scale this PR campaign to continue the momentum. Is that okay?
Thank you.
You got it. Next slide, please. So this is the ask, right? It's $4 million over 3 years. It's 3 years because of state issues related to contracts and their length. We'll talk about that probably never, but next slide. Okay, so just to show you real quick so I can breeze through this, what I just presented to you was item number 7, right? So the entire PR campaign is not $4 million. The entire ask is for $4 million. What does the rest of the ask provide? So the rest of the ask provides, real briefly, 1 through 7, strategic communications, branding, PR activations, media relations, partner communications, and internal communications for the first 5 California agency. Next slide, please. And next one. And again, this is, I showed you the will building strategy, the theory of change related to this. This is the PR piece related to the same kind of theoretical concept that we use to amplify and inform our work. Strategic relationship building, professionalism, crisis management, feedback loops in terms of conversations, enhanced visibility, and cost effectiveness. These are items 1 through 6. Next slide, please. And so, as it relates to some of those items, just to explain to you what, again, those items 1 through 6 are about. It's about the production of the annual report, fact sheets that go to the legislature on a number of issues, and also brand guidelines related to First 5 California and its social media and media aspects. Next slide, please. Also, it includes uplifting First 5 California's profile, so the monthly newsletter. You see our Commissioner Bobby, as she was again introduced to the commission. These are important for keeping all stakeholders informed. Also, public radio, particularly Director Wong is on National Public Radio often to discuss some of the key issues. On this particular day, she was focusing on AAPI Heritage Month, the connections with ACEs and toxic stress, and then finally article placement in the LA List and other periodicals to make sure, again, that the message around ACEs and toxic stress related to the North Star Audacious Goal are socialized in not only social media, but media in general. Next slide, please. Of course, again, advancing the ACEs conversation. If the North Star and the Audacious Goal is our focus, then we are going to consistently have conversations around ACEs that includes a bevy of stakeholders. Not only with Director Wong, with meetings at the White House, with the Vice President's staff, but also at the Federal Reserve Bank, which this is an engaging conversation. If you get a chance to talk to Director Wong over coffee about talking to the Federal Reserve about ACEs and toxic stress, mind blowing. Also, the ECE funders convening is important. And recognize, of course, that 1 through 6 includes all of the work that we do at the summit. So summit support from everything that happens. And again, thank you all for coming to that. And we're ready to do it again in 2026. Next slide, please. This is the internal team building, so staff and communications media training, which is not only offered to staff, but to commissioners. Mainly because the media is the media, and we need to be able to stay on message and to know how to talk to the media. Next slide, please. So the program description, the program goal, they're all important, but the program focus, right, to enhance access to early childhood environments. This again is the underlying focus of everything that we're doing. Next slide, please. So I think this is the last slide, just a reminder of the difference between PR campaigns and media campaigns. The PR campaigns are for stakeholders. They're for will building, influence, and public opinion. They are focused on organizational level communications and First Five California branding. They are to elevate awareness, visibility, and expand support. This is different from the larger media campaigns. The last thing I'll just mention is that we are very appreciative of all of the support, not only from Supervisor Ellenberg, but also those advocates who I believe will speak during public comment related to the child care affordability campaign. And that's it.
Thank you. Should we go right into public comment? Is that your recommendations? And then we can take questions maybe after everything.
Absolutely. Can I have one piece? Sorry, just real briefly. So also, I think you all know this, but it bears repetition that Prop 10 mandates that we focus on media. It's mandated. It's not something that we do. It's mandated. Statutorily mandated that a part of the mission of First Five California, as it was created by Prop 10, is to focus on the media.
Thank you. So I think we're going to start with members of the public to have comment, and then there might be some discussion items, and then we'll take a motion. I think we have 8 members of the public.
Yes, that sign the public comment sheet.
Perfect. So if on item number 7, if you would like to speak, please come up to the podium. Just for efficiency, if you could come up and maybe form a line here, that would be terrific. And feel free, please start. Thank you so much for being here. You have 3 minutes.
Can I just speak?
Yes, I think there's somehow the microphone is working here. I thought.
Okay. All right, hi, Chairwoman Albright, Director Wong, and Commissioners, thank you. Dr. LaWanda Wesley, Child Care Resource Center. We serve about 75,000 families in northern Los Angeles and all of San Bernardino County. And so I'm just going to just share that we were one of the organizations that stood strong with First Five California on the day that they launched their public announcement in support of Raise California Strong. One of our 4 strategic goals for our organization is whole child and whole family systems. And what I wanted to share is that our organization has been trying to do a lot of what Raise California Strong is doing, is raise the urgency around the issues that is faced in our childcare sector. And that is, we use the term dark classrooms, dark programs, because there's a mass exodus of the workforce. When the business economic point that was raised today by Dr. Angela Williams and through the report, I, as a preschool teacher, was impacted and couldn't stay in the field. I, as a parent who was on subsidy, needing the resources, was having a hard time placing my 5 children in programs. And so I was on both sides of the system. Dark classrooms and dark programs is a real thing, meaning we have our workforce leaving the field for gig jobs, whether it's ride share, whether it's a $20 a job working in the restaurant industry. We recognize all good jobs are dignified jobs, but from a business economic standpoint, we can't uphold a workforce who can't get paid well. So how does this hit the business field? Well, where are you going to send? One of the number 1 reasons that families call out sick and can't go to work is because they're calling in sick. And so that's an issue. And grandparents, I'm a grandparent, I'm a mother of 5, a grandparent of 6. I'm here for you, but I'm here at work right now. I'm that grandma. I'm still working. And so we've heard in the echo chambers, grandmas are the solution. Not all of us are at home knitting. So, from a business standpoint, from an economic standpoint, or the workforce, we have to figure this out. And the last thing I'll lead with is that from an ACEs standpoint, and a child myself who was in the foster care system, and why this matters to Child Care Resource Center, is that we know that childcare is the one concrete support that if families have access to childcare, it reduces ACEs, adverse childhood experiences, and can mitigate for family well-being across family well-being systems. So this is both economic needs, this is both an ACE workforce issue, and this is also a family well-being issue. So we urge the support and investments for Raise California Strong. So thank you.
Thank you. And I realize for members of the public, feel free to sit down, maybe just, I know you might be up for a little bit. So whatever is most comfortable. Thank you to the last speaker.
My wife just told me it was time for me to stay. Good morning, or maybe afternoon. My name is Anand. I am the Chief Executive Officer for Child Action. It's right here in Sacramento County. We serve approximately 15,000 children and provide services to about 3,000 providers. Listening to the proposal, one, I want to thank all of you for considering this proposal in the Public Affairs campaign, all of you commissioners, because I think for me, it really dovetails nicely into the work that I'm trying to accomplish here in Sacramento. To attack the issue of childcare and early childhood development, relying strictly on the statewide investment is no longer the case. It will never solve the problem for the need that we have around affordability and access. We do need a three-pronged approach, and that's actually what I'm really trying to accomplish here in Sacramento County, is that we have to have that local government investment, we have to have that statewide investment, and quite honestly, we also need our business community. The need around economic development, some of our businesses continue to kind of not realize that if you want your culture to be a certain way, if you want your employees to be cared for and understanding and showing up for work, guess what? Make sure their kids are taken care of. And we're beginning to have, at least I'm personally having those conversations locally about what it means to have an investment from our business community to really look at how childcare impacts their economics, their employees, and how, quite honestly, how they're making money. And so this initiative really dovetails nicely into what we're trying to do and what we're trying to accomplish. And not only does it do that, but it brings up a whole level of statewide visibility, which is another key aspect of the work around childcare. You'd be amazed at how often I lead an organization that's been around for 48 years. And you'd be amazed at how often I would go into different rooms that people don't even know we exist, but they do know childcare is an issue. Right. And so it's being able to have that visibility from a statewide perspective that then we can use locally that really enhances and uplifts our work. And so I really want to respectfully urge you to the commission to adopt this and invest in this campaign. So you have no idea how much it will really help us, all of us locals and all of my counterparts from around the state to really uplift the work that we're doing to really engage families and make sure all of our children are taken care of. And so thank you very much.
Hello, I'm Jennifer Keller-Floyd. I'm the Executive Director of First 5 Santa Clara. I'm the lucky Executive Director who gets to work with Supervisor Ellenberg. Not every day, but many days. And I just wanted to highlight, as she shared our work together on Build the Future and her vision, that we don't miss an opportunity to collaborate and align on our various campaigns and efforts. And how do we together define success of these different campaigns that really have the same goal, right? To elevate the need and really mobilize community to action. So I hope that as this moves forward, that we really align together and talk to our different communities about our different solutions, as the same solution might not make sense in a tiny rural county as it does in an urban county like Santa Clara. So I hope we can continue to have that conversation as an entire network of First Fives. Thank you.
Thank you.
Morning, Samantha Bond, Executive Director for First Five Lake. She actually said a lot of what I was gonna say, so let me rethink this for a second. No, I do think that it's really about collaboration. You have 58 counties here in the state of California who are willing and able to help, especially with those local governments pieces. And I'm somebody who's been in the First Five realm for a long time. I've been the Executive Director for the last 3 years, but I've been in this realm for a while. And I know nothing about this campaign until today. We've heard a little bit about it when it launched. We heard a little bit about it when we did the communications call, but really the deep dive of it was heard here today. And I think that that's kind of a misstep for us. We really have that opportunity. And I am somebody who's in a small county, very rural county. Yes, we're next to Napa, but you got to go over the mountain and you kind of bark through, and then you hit the lake, and then you find us. So, yeah, you have a bark. It's funny. You can't handle the roads. You can't handle the it's beautiful. Don't get me wrong. But you do have to take that time to get over there and to get into our government. It's different than here in Sacramento. It's different than Clare County, and I would love the opportunity to actually work with people collaboratively. While we may not be your target audience, we are the target collaborator. Thank you.
Thank you.
Hi, everyone. Melody Easton, Executive Director for First Five Nevada County, another one of our 21 smallest counties. And something I did observe in the presentation is that very few, if any, small counties were included in that initial data grab in 2022. And so should the commission proceed with funding PR campaigns, this one and future ones, I think Courtney mentioned it earlier, making sure that those small rural counties are included in the data conversations, in the focus groups, because we do provide a really unique perspective. And I would also argue that as we proceed forward with the campaigns, that we include the subsidized care and universal preschool, because, and I know it's not unique to Nevada County, we are hearing parents turn down jobs because then they won't be eligible for care. And so that's not advancing anybody's economy, and it's not serving anybody in any county. I do want to share really exciting news from Nevada County that our public health in their recent community health improvement plan called out childcare as a public health crisis. And so that is a really exciting opportunity to collaborate within this campaign. And I shared the campaign with the work group that I'm part of as part of that plan development and action development. And they tried to interact with the website. But again, it was the first time they had heard about it. Folks, partners from the local planning council, Quality Counts California. And so continuing the communication and collaboration moving forward, I think is going to be key to the success. Solution agnostic is a new term to me. And I benefit, and I think a lot of the small counties specifically where we've got small budgets and don't have the beautiful marketing budgets, benefit from hearing like this from the Santa Claras and other communities where they've been able to do something really successful and step back and say, okay, what can I do in my community that might not look the same, but could look similar? And so while remaining solution agnostic, hearing those success stories are really, really valuable. And I appreciate everybody's time.
Thank you.
Good morning. My name is Nicole Hinton. I'm the Executive Director of First Five Moda. I'm also the local planning council chair. It was wonderful to hear all the work that First Five California is wanting to invest in. And just like my other First Five County colleagues, I urge you to collaborate with us First Five Counties and other partners within the realm of childcare. I also have a contract with our R&R. We call it Teach Tuesdays because the agency that hosts R&R there is called Teach. And we actually work very closely on what's going on with universal pre-kindergarten and all these other wonderful things. As a small, we do urge you to work with us so we can best lift up the messaging that is coming out of First Five California to elevate all children in all 58 counties. Thank you again.
Thank you.
Good afternoon. I'm Tammy Say, First Five Minnesota Executive Director, and just to echo again collaboration, but also just to engage the commission to look at funding that's outside of just the state to see about federal funding, because it is also within your statute to apply for grants and other, donors and what have you outside of California, and to see if what legislative support, instead of just using Prop 10 funds to lift this childcare crisis, since it is a national crisis. The First 5 Years Fund, which is a national organization has lots of data and a lot of research that we could just use instead of reinvesting in it and duplicating services and funds. So just, thank you.
Thank you. Is there any other member of the public who wishes to make comment? Yes.
I'll go back to that First Five Association. Thank you, commissioners and staff for that presentation. Supervisor Ellenberg, supervisors have a way of like getting to the heart of an issue. So I'll just say she's also my former supervisor where I live, and really appreciate how she framed the issue and what's happening in Santa Clara County. I just wanted to make one point, and actually two quick points. One is that the solution agnostic phrase is a new one. And I think I understand why it's being used, but what I would encourage the commission to think about is really naming what we need here. Supervisor Ellenberg talked about it directly, and she talked about multi-billions of dollars in subsidies to get to affordable childcare for everyone. And so I'm hoping that as this campaign, if it moves forward, hoping we can be a lot more bold in what the solution should be and ensure that it goes not just from awareness of the issue, but awareness of the solution. And that doesn't mean awareness agnostic. That means really landing on a multi-billion-dollar investment to make childcare accessible and affordable, and pay the worthy wages that it deserves. So we get it, and we're hoping that we can be much more bold in our language moving forward. The second thing I'll say is about uplifting First Five California's profile through this effort. I want to just remind everyone that we all wear the same name badge, the 58 counties, the association, and First Five California. And so when we are out there uplifting profiles, whatever the tables are, whether it's you, Director Wong, or Chairwoman Albright, or any one of our commissioners, you're speaking on behalf of everyone that wears the same name badge. And so it's not just uplifting the First Five California profile, it is lifting up the First Five Network profile. And with that, you heard a lot of colleagues talk about being involved and included and aligned to that uplifting of the profile. So just want to name that again. Thank you all.
Thank you so much. Any other member of the public? Looks like we have one member online.
Yes, Eva Rivera.
Good afternoon, Executive Director Wong and First Five California Commission members. My name is Eva Rivera, and I am the Policy Director overseeing early childhood development at the Children's Partnership. On behalf of the Children's Partnership and as a co-chair of the Whole Child Equity Partnership, we deeply appreciate First Five California's commitment to enhance access to early care and education for young children across California. Given our shared goals for child well-being, we deeply believe in the importance of coordination and collaboration in order to be more effective in our work for California's youngest children. As the Race California Strong campaign progresses, we encourage First Five California to coordinate with existing partners in this field to not only strengthen the campaign, but also to amplify the efforts of all stakeholders involved, including a clear policy and revenue strategy. Additionally, we would appreciate the opportunity to learn more about First Five California's vision for the term whole child as it pertains to this campaign. Thank you.
Thank you. Any other member of the public online?
Yeah.
On this matter? Thank you so much. I'm going to open it up to commissioners for comment, and want to make sure that Commissioner Majors being online, you have opportunity for public comment. Yes.
I don't have comment right now.
Thank you so much. Any other?
I would just like to say that we heard you loud and clear. I tallied collaboration and alignment 7 times. I made notes and made tallies, so Thank you.
Thank you so much. I also tabulated small counties. So adding that to the list.
And I'm glad that you highlighted the Prop 10 mandate, that needs to be fulfilled.
Thank you so much.
So if I may just
Yeah.
add to those comments, the action today is to approve up to $4 million to engage a consultant over 3 years to be able to promote the Raise California Strong PR campaign, correct, Dr. D'Angelo?
Correct.
And so, oh, sorry, my apologies.
No, no, no. Okay.
I just gave you a new last
And
name.
I'm just saying, but the D'Angelo. No. I mean, I like it. Exactly.
I think it's time for lunch soon. So it sounds like we have a lot of data that we're bringing to the table, and really now it's a matter of how we push those messages out, how we tailor it specifically to each of the various sectors. And I agree that this is really a issue that all of us collectively, not just those of us that work in this space, really have to up and support, because we do need our parents to work, and we do need to make sure that the children are receiving more than just safe care in their communities. So I will make a motion that we approve staff recommendation for the $4 million up to 3 years, with the expectation that there be more input on collaboration, alignment, including small counties and others in the next steps to make sure that it is a PR campaign across.
I second that motion. Thank you. Is there any more comment before we take? Yes, Commissioner Wilson.
Yeah, so I guess I'm curious, I'm thinking about outcomes, right? So I think one of the things that I'm sitting with, and I think this is an important campaign, and I think the issue is critically important, but I guess what I'm sitting in is awareness raising enough? And so it's a curiosity around, will we be collecting data on behavior change? What changes as a result? Is that part of this? Maybe it was in the scope and I missed it. But if you can speak to that.
Sure. Again, the unexpected supporters, right? Unexpected advocates, that's really the target. It's the business folks and others. And the idea of the campaign, we can put the slide back up if we want to. The idea of the campaign is really focused on that urgency, right, around. And the reason why it is so lucid, I so appreciate what Alva was saying, is because there are right now actively at least 10 different proposals at the federal, state, and local level, between working groups at the federal level, at the city level. You just heard from the county of Sacramento. And what we're really trying to do is create a collective impact orientation. And we come out and say, this is our bold new thing. We're going to lose about 10 or 15 right folks that decide, no, we want to do it a different way. We actually, and I appreciate your comment, Commissioner Newman, is take the time to actually have, right, those conversations around the scope of work, right? The scope of work is really where all of the input that we received today. You'll also hear Dr. Dominguez Brinkley talk about the SBCFA conversation with at least 2 or 3 months of input, just for the purpose of trying to gather all of the information about how this should work. So it's really about an urgency campaign. It is oriented towards awareness, but it's oriented towards action and pain points. Just one more point to make. So if we're talking to a business owner, part of the conversation has to be, part of the data, the social media, the conversations, the convenings has to be around them sharing their pain points around workforce, and us sharing our solutions related to childcare. We have to convince them, right, that while again, you don't have to care about children to care about the economy. If you do, you might be able to create a solution for any kind of issue that may have around bringing folks back to work or advancing your workforce, right? That's really the kind of strategy. I hope that answers your question.
Yeah. And I guess my hope is, as we put out an RFP and identify a PR firm to move this work forward, and I've worked in PR myself, often the metrics that we look at are media impressions or output. general, and so I would encourage us to the extent possible to identify metrics that are really tied to outcomes, right? How many businesses decided to offer or subsidized childcare? Did we see an increase in subsidized, like, what are those things that over time we hope to change? I recognize we're talking about a 3-year campaign. I think it's really important that we think more broadly than just how many ads did we put out, how many conversations did we have, but what happened as a result? Recognizing it's gonna be slow progress, but that's really important to me as a commissioner to be able to hear how we're doing, both in terms of the what we're doing and then what happened as a result of that.
Appreciate it. Thank you very much. We'll absolutely include that input as well. Thank you.
Commissioner Majors?
Yeah, I'm sorry, you guys, my voice is going, but I did want to just say, one, I wanted to thank everybody who spoke on this. The investment in is essential. And I think that's what I heard out of everybody, including the supervisor. I also heard, I was taking all public comment, but childcare is a public health care crisis. And while I appreciate all the need for and the desire for collaboration and metrics, it is an urgent issue that we need to move forward. We realize this is not the solution. And I don't think in any of our pockets we have the solution. But I know one of the things we all want, and that is for some of these unexpected advocates to come on the other side so they can also start supporting, voting, realizing the importance of what childcare is doing to our economy. So I trust in the things that we've been able to hear, not only in this group, but in our committee, some of the work that is going into understanding what the challenges are, understanding who our key players are, but also understanding the capacity of what we can do. The collaboration will not just be to inform First 5 California on how we move forward, but also on what parts can break off in 58 ways for others to come together and support this initiative. So thank you. I think that's all my voice.
Thank you so much. We appreciate that. Any other commissioner comments? We have a motion. It's been seconded. If I could please ask Anisha to call the roll.
Katie Albright,
Aye.
Shayna Hazen,
Aye.
Elsa Jimenez,
Aye.
Jackie Majors,
Aye.
Vivian Velasco Paz,
Aye.
Lori Rizzo,
Aye.
Amy Bernardino Palmer.
Aye.
All county.
Thank you. It was a unanimous vote approving item number 7. Thank you very much. Appreciate that. We are gonna break for lunch in potentially 10 minutes. I wanted to ask one thing. We have one item I think could go relatively quickly. Are there any members of the public that would speak on the consent item? Any members in the room? Any members online that would wish to speak to the consent item? Okay, seeing none, I'm gonna take this item and then we'll break for lunch. This is item number 3. We're now back on our calendar as ordered. Item number 3 is items on the consent calendar typically include prior commission meetings. You can see a slide right here, and ratification of contracts that were either already approved by the commission or fall at or below $150,000. Consent items are to be considered routine and will be enacted on by one motion followed by a vote. There will be no separate discussion of these items unless the commission, member of the public, or staff requests specific items be removed from the consent calendar for a separate discussion and action. Any items to be removed will be voted upon following the motion to approve the consent calendar. As a reminder, and a friendly reminder, regarding ratifications, because I had some questions about this, so I thought that maybe others might wanted to make sure that we talked about this a little bit, or that I made a statement about it. The California Children and Families bylaws state that the first 5 executive director and the chief deputy director have delegated authority from the commission to enter into or amend contracts of $150,000 or less that are deemed necessary and appropriate to carry out the provisions and purposes of the California Children and Families Act. Do we have a slide on this one? I don't know if we do, but we'll put it up next time about ratification.
Okay.
And this is, we can send this out too, but just if people have questions. For all contracts in excess of $150,000 after the commission has authorized expenditure for such contracts, the commission delegated to the executive director and her designee the authority to award and enter into such contracts. Once executed, all agreements in excess of $5,000 must be ratified by the commission. I know that was a lot. It wasn't a word salad, but a lot of words. So does any commissioner or member of the public wish to pull an item that is currently on the consent calendar? Seeing no commissioners, yes, we have a member of the public.
Madam Executive Director, first I would pull the minutes, please.
Sure.
Thank you.
Okay, the minutes are pulled. Do I have a motion to approve the consent agenda without the minutes? Is there a second?
I'll second.
Any comments? Any public comment on approval of the consent agenda? Okay, seeing none. Could you call the roll? Thank you so much.
Katie Albright,
Aye.
Shayna Haven,
Aye.
Elsa Jimenez,
Aye.
Jackie Majors,
Aye. Aye.
Vivian Velasco Paz,
Aye.
Lori Rizzo,
Aye.
Amy Bernardino Fabi.
Aye.
Thanks so much. And Simon, did you have a slide that you wanted just to make sure?
I did not.
Okay, perfect. Okay. How many members of the public are interested in speaking in terms of the minutes?
And there are two sets.
Say it again.
And there are two sets of minutes.
And two sets of minutes. I see one member of the public. Any members online wishing to talk about
I
the
see
minutes?
none.
Okay, perfect. So we'll do a motion separately on the minutes. I am so curious. Minutes are usually never pulled, so please come on. I will say that the minutes include a lot of letters of support that were brought to us at our last meeting. Those are listed in the minutes, and hopefully we got all of them.
We have two sets of minutes. So there's the refugee, the roundtable, and so we pulled both, FYI.
Sorry, didn't mean to make you pull both, but. Yes.
That's okay, we'll do them in one
separate,
vote, but which, please speak as a member of the public.
Thank you. For the, not the roundtable one, but the other one. There's some point of correction that I want to make sure that we do is making sure that all of the names are correct. We have an executive director listed from Mendocino County. Her name is Townley Say, not Say Townley. Additionally, I wanted to see if there was a way that for the public comment under the, after the letters of support on page 8, it just says several members, if we're able to list all members, please.
That's a really good question. I had the same question. I think there was, I'm not sure we got everyone's names. I think people went back, the team went back and looked at the tapes about that. Simon, were we able to do that? I know Lisa looked at that.
We'd have to go back and look at the video if we can hear exactly who it was. It's real difficult in public comment of that size, so that's why we summarized the way we did.
I'm gonna do a pre-interference product out of order. We are going to be creating a YouTube where all of our Zooms for the last 3 years, so that's transparent. So ever since, I guess, we started recording them on Zoom, so they will be on a CCFC YouTube site. So I think that's also an opportunity to provide transparency and clarity of all the people and all their comments at those meetings.
It's also one of the reasons why we're doing roll call,
Yeah.
so that we have them, and we didn't know that at the last
Yeah.
meeting. So I very much appreciate the public comment. It's certainly our endeavor as a commission to be as transparent as possible and provide access to that. And unfortunately, we just don't have the technology for the last meeting to do it, and that's why it's here. But thank you very much for that.
Hi, Courtney Armstrong with the First Five Association. I believe I have a list of all the names, but I don't know if that counts for your record keeping.
You could provide it, then we'd hold on these minutes. And
Yeah,
we'd have to produce,
and
we'd have to
approve
approve
them
at
at
the next
commission
meeting.
meeting.
I'll send you what I have, and then also just while we're on this item, appreciate the recordings being made available. That's very helpful for us. And then also, I know there was some question around letters of support meeting like ADA requirements or something so that they can be posted on the website. I believe that came up in some of our communication. And so I just wanted to, I don't know if this is the right time to raise that, but if we could get clarity around what that means so that we can make sure our letters are compliant in the future so that they can be posted as part of the meeting materials.
So, thank you very much. Going forward, we are gonna have a portal, could be as simple as just an email. We'll provide that, after lunch. Where all submissions will be given to that, portal so that we, are able to make sure that we have everything that we collected. My understanding in terms of past precedent is that letters themselves are not actually posted, but that the names of the senders are, which is what we have done in the minutes, as well as going forward. And certainly if you have a list, we can make sure that we do that going forward. In terms of submitting letters, actually posting those on the portal, we are required by state law to ensure that anything on our website is ADA accessible. It's something that the team spends a good amount of time to ensure. And that means that it would be great. I know you guys, the association produces PowerPoints often. It would be great if you guys could help us with that. And we still have to do our work to ensure that everything is posted. It's a requirement of state law. So why don't we do this? I think we can make a commitment around the PowerPoints. Those have been up in the past. Let us, I don't want to put the team on the spot because that's a big request. So let us think about how letters can be posted. We do want to ensure that everyone has access to information, and we also have we have staff capacity, and we have this requirement that we have to look at them. So
Yeah,
hopefully
and
that
that's fine,
answers your
just-
question, and you and the association, the team and the association's team can work together around how to
Absolutely.
create increased transparency.
Absolutely.
Yeah, just so we know what the requirements are, so
Yeah.
we can follow them, and same for our PowerPoints. And also I noticed Dr. Williams' PowerPoint has been updated, so we can get the updated one.
Yes, that will be posted.
Great, thank you.
I think our past practice and going forward is that everything is posted after the meeting for this very reason, that sometimes between the time it's posted and the time you have a meeting, there's changes to decks and that kind of thing. And so, yes.
And that's just specific to the decks, not the items which are always posted in advance. So that's always been our practice pre and post pandemic.
Simon, anything else on this? We've worked a lot, the team since our last meeting has worked a lot on this question. I know.
Yeah, no, I'll put up a slide, so when we come back to lunch, I'll have that email, any questions, comments, clarifications, or, if we spelled something wrong, would love to hear those. Kind of outside of commission meetings, so we will be on standby to answer any of those, receive those, pass those to the commissioners.
Thank you. So we are going to make a motion to approve the minutes for the roundtable discussion. We will hold the motion on the minutes for the commission meeting until our next meeting, until those get updated. So thank you. I didn't make one, so you're going to move it. Is there somebody that can second it? Thank you, second. Can I just do all in favor? Any opposed?
I would say some commissioners were not there, so there might be.
That's okay. You can vote on minutes even if you weren't there. All in favor?
Aye.
Any opposed? Terrific. Seeing none, the motion carries. We're going to adjourn for lunch. We'll be back when are we back?
Let's see, 1:25.
1:25. Thank you. We have people of public comment in the room. 6. How many people online?
2.
2 online. Hang on, I gotta do my minutes. If we could have 2 minutes each. Thank you very much.
Good afternoon, Madam Chair, Commissioners, Alba Macdessian with the association again. Thank you, Commissioner Hernandez, for the update on the Fiscal and Audit Advisory Committee next steps related to the stabilization fund proposal. We look forward to working with you and Commissioner Rizzo on learning more about what the next steps could look like for the stabilization fund. And hoping to build a longer term runway or on-ramp to sustainability for the entire network, because I know that's top of mind for everyone. We also just want to recognize that the stabilization fund proposal was always intentionally broad to allow for a lot of room of co-creation. And so we're hoping that that co-creation does take place at the advisory committee level. And as I've shared with Director Wong and her staff, we are committed to hopefully come back in January with a jointly agreed upon path forward for this commission to consider. On the presentation on finances, I just want to say that the counties are also feeling the decline immensely and have been for the last couple of years. I think the difference, and you may hear from colleagues here about it, is those declines and cuts that are having to be made are directly affecting kids and families and nonprofits and the entire ecosystem and local communities. Much different than some of the state level cuts that I know may have to happen, but they feel it. They feel it directly. They have to have conversations, not just at their commission meetings, but also in the grocery store and on the street with families and providers directly. And so just want to emphasize that. And then last, the 3% decline, projected decline due to the unflavored tobacco bill 3218, if I'm getting that right. We'd love to see any other projections that the state may be tracking or seeing with that decline. Our initial thought is that since this bill was meant to address new tobacco products that came online after the flavor ban, that it wouldn't affect any projections that we have right now. But would love to see more analysis so we can prepare. Thank you.
And if you could please state your name. We have the sign-in sheet, but just to make sure that we have everything.
Good afternoon, Angie Dillon Shore, Executive Director of First Five Sonoma County. On behalf of my commission and the kids and families we support, standing with our network of local commissions, the association, many legislators and county supervisors that submitted letters, here to voice support for the establishment of the $25 million stabilization fund. As the Prop 10 reserves spent out at the local level, the annual revenues decline. Many of our local county First Five commissions are increasingly being forced to make difficult choices when it comes to continuing programs. The vision in 1998 for Prop 10 heavily focused on this network of our local First Fives on the ground, supporting children and families in real time. But we're only as strong as our network. We can't allow the infrastructure to put falter even in one county. We can't stand by as local First Fives and their nonprofit partners lay off critical child and family serving staff. Can't stand by as local First Fives close family resource centers and sunset parent support programs, or as local First Fives roll back investments in childcare facilities while childcare deserts exist all over the state. By developing a stabilization fund, First Five California can ensure that each county can continue to support families using an equity lens that reflects local context, needs, and urgency. So we're very pleased to hear that First Five California has expressed the commitment to work with your fiscal advisory committee and the association to refine the proposal for the fund. We hope to see the momentum continue and urge staff to bring that $25 million stabilization fund proposal forward by for the January commission meeting for approval by the state commission. Thank you so much to staff and commission for all that you do.
Thank you. Next speaker. Maybe we can just have the next person right behind. So thank you.
Good afternoon, Mary Ann Hansen, First Five Humboldt. First, I want to express my deep appreciation to your commission for the work to make your decision-making processes more transparent and understandable. to your interest holders. I want to shout out kudos to Martha on her work and her presentation. The counties have come together to ask First Five California to be an authentic and engaged partner to stabilize our network in this period of new and drastic revenue decline. Without meaningful and substantial engagement with the counties and investment in stabilization, we risk the collapse of the only consistent cross-system, all-county effort on behalf of California's underserved. So on behalf of the First Five Humboldt Commission and my Board of Supervisors, as evidenced in the 2 letters that they've submitted, I want to urge you to bring the stabilization proposal back to your January meeting for a vote. Thank you.
Thank you. Next speaker.
Thank you. Good afternoon. Tom Massey with First Five Mendocino. I just want to thank you for the fiscal review. I'm way into like numbers and looking at them and having full transparency, so I really appreciate that. And I'm just going to lean a little bit different to talk about, the statutory obligation that we have at the state level and as well as at the local level. And I understand that there's the 20% allocation that you guys have, and it's mandated in the statute of where it should go and how it should go. But I would like to just press and just remind this board that you also have the authority to transfer that to unallocated to meet the priorities at the local level as needed. So that's in section 131025 of the statute under your powers and duties. And I feel like under that statute as well is the larger kind of letter of the law to address parenting concerns, resource referral, essentially in childcare and what have you. And that's really how we kind of really address the ACE and the topics at that local level. And so I really just want to encourage us all to co-create and to work to support the creation of the stabilization funds.
Thank you very much. Next speaker.
Hello again, Jennifer Keller-Floyd from Santa Clara County. I'm the Executive Director. I've actually spoken with you all last January as well as last August related to sort of the impact of revenue decline in Santa Clara County, so I won't belabor that today. But what I haven't shared is that similar to many other First Five, Santa Clara has also leveraged more than 50% of its revenue from things other than Proposition 10. And I know that's something that came up in August when you heard from a number of the other commissions that we have been creative and diligent and frankly aggressive in pursuing other funding opportunities. And I just want to make sure you all are aware of that. I am very happy to hear that meetings will be scheduled. I'm a little disappointed that they're only going to be scheduled now, since this has been something that was brought to the commission's attention in May. And I recognize that at a certain point, for some of our commissions, certainly not mine, we are in a better position than others, but there are some that time is of the essence. And just to reflect our same level of urgency around childcare, which I completely share with this staff, I think it's important that we also realize that at a certain point, there will be urgency for some of our county partners and we won't be able to rebuild. So I think it's important that we have these conversations. We talk about both short-term and long-term sustainability together, because we can't do it 58 different solutions at a time. Thank you.
Thank you. Next speaker.
Good afternoon, Commissioners. My name is Anna Badaka, and I'm with First Five Alameda County. We know we are at a critical point where the decline of funding of First Five may potentially undermine decades of investment in various counties throughout the state. And over the past 20 years, and with heightened urgency, Alameda County, First Five Alameda County has worked closely with our local leaders to leverage the federal and state funding. And over the past 7 years, we're successful in local measures at the city and county level. And while we celebrate this growth, we think it's one example of the critical roles a First Five can play in the local landscape. But that work has not been easy. And system building and policy advocacy is a long game and requires steady, stable, and resourcing to support the persistent, strategic, and intentional effort it requires to do the work. Given all this, we believe that the state should support local systems building efforts to achieve stability and sustainability for families with young children, and to ensure First Five may be positioned like Alameda County to expand and evolve their early childhood systems as articulated in Vision and Top 10. We politely request that the first 5 California Commission leadership commit today to bring back the stabilization fund for action and approval at the January meeting. Thank you.
Thank you. Next speaker.
Good afternoon, Anna Bauer, Butte County. I of course echo many of the sentiments of my colleagues, and I was sitting here reflecting on the CAPC day that Chair Albright, you and I were both at yesterday, and how on many of the slides in the how to finance and fund CAPC's first 5 is there, right at the top of the potential funding. And it really got me thinking about, first the ever-present perception in the community that first 5 is a critical funder, convener, and administrative backbone of this work. And whether our balance sheets say that we are not, that continues to be the expectation of our communities. And I think we're just in this moment of almost to FFPS, right? Almost to understanding the potential of CalAIM, almost to some of our communities having these tax measures passed. And it's just that we're in this really important 5-year period where we've got to remain stabilized, because if we go away, there goes the CAPCs, right? There goes the ability to do prevention in our communities in many ways. So thank you for hearing my concerns, and I urge you to break the stabilization funds and convert.
Thank you very much. Any other speaker in the room? I think we have 3 speakers online.
We do. Dan Berman.
Speakers online, 2 minutes each, please. Thank you very much. Mr. Berman?
Thank you. Dan Berman, calling from Humboldt County, California. I echo the comments made previously about the stabilization fund. I had a much more specific question though on slide 6 of the slideshow showing projections out in the future. There's a interest line, and it really just caught my attention that the number for interest, which I assume is sort of interest and investment returns, is exactly the same across the whole table, even as the net fund balance, goes from 150 million down to 40 million. And it seems like that should be, I don't know, I've never seen any information about the returns that the commission has gotten or that the controller's office gets on those fund balances, but it doesn't make any sense that the interest amount would be the same across wildly different fund balances. So that was a question. And then also, as you looked out into the future, the slide's not up now, but at 27, 28, it's got the net expenditures dropping basically by 50% in a year. And maybe I sort of got from the presentation that that's partly just an artifact of not having expenditures planned out that far in the future, but it doesn't. I guess I would just encourage you, just as we in the county organizations are planning how to deal with this significant funding decline, I certainly encourage the commission not to drop expenditures 50% in a year. That doesn't seem like a appropriate way to manage a foreseeable long-term funding decline. So maybe that's just an issue of not having those expenditures programmed yet, but it sure stood out. Thank you very much. Appreciate you.
Thank you. Next speaker.
Lucas.
Oh, good afternoon, Chair Albright and California First 5 commissioners and staff. My name is Lucas Frericks. I'm chair of the Board of Supervisors of Yolo County and also chair of First 5 Yolo and a member of the CSAC Child Care Working Group. Appreciate the opportunity to make a follow-up comment from your last meeting, respectfully asking you again to agendize the $25 million stabilization fund at your January 2025 meeting. In order to address the decline of Prop 10 revenue, I want to add my voice in support of the First 5 Association's proposed $25 million stabilization fund to address short-term challenges facing the counties and allow for stabilization in the short term and support building a longer-term sustainability as well. Considering the bleak fiscal landscape and threats to services and near-term impacts on young children and families throughout Yolo County, I greatly appreciate the First 5 Commission's commitment to creating a process to consider the $25 million stabilization fund to support children and families more directly throughout California's counties. I'm also heartened to see the recent letter from numerous state legislators in support of the stabilization fund proposal. Respectfully request that you bring this item to your January commission meeting for a vote, and just thank you all again for your service on behalf of our state's most vulnerable children. Thank you.
Thank you very much. Next speaker.
Jenna Flush.
Hi, can you hear me?
Yes, we can.
Okay, thank you so much for your time. I'm the business manager for First Five Mendocino, and I'm calling in to support the $25 million ask for the stabilization fund. I've been with First Five for nearly 10 years now. And in my entire time with that organization, I've been a parent of a First Fiver as well. And I know the direct effects that having First Five in your life can have. And I would hate to see that the stabilization fund wouldn't be able to support those counties and the parents that need it most with our population. I don't think there's anyone in the room that would disagree that toxic stress is horrible for young families and that it needs to be addressed. And I think the concern is that a lot of the funds are sunsetting to support our local First Fives, while there's an ask for $57 million for a PR fund. And those First Fives are working directly to negate toxic stress, not just putting the message out there that it's bad. So I would really love to support the $20 million.
Thank you. Is there any other speaker?
We have one more, Karen Potts.
Hi, this is Karen Potts, and I'm the Executive Director for First Five Siskiyou Children and Families Commission. I apologize, I'm not there in person because I'm finishing reports, as some of you know. I just wanted to echo everything that everyone else has said, and just reflect back in my 20 years, you know, the level of commitment and the championship that we've had in working together with First Five California and our association. I go back to the same question to myself and to us. If not this, then what else? This is the foundation that's needed for everything else that First Five California invests in to make the kinds of improvements in the community. We're your feet on the ground. We're your champions. We're your supporters. We're together stronger, and our request is key to continued connection and diversification of funds, not just to support the local, but to support the statewide effort as well as national efforts in the coming years. Thank you, and I look forward to seeing this on the agenda in the next meeting.
Thank you. Any other member of the public?
No.
Any other member of the public in the room? Okay, thank you so much. Public comment on item 4 is now closed. Yes, that'd be great. Director Wong was going to address one of the questions that was raised in the public comment
earlier. Just as a point of clarification, thank you, I was gonna say Director Thomas, for going back about our audits and our financials. They're actually on the Department of Finance's website, is that they are the people who audit us. And so they post that. And so if you go on Department of Finance, those documents should be readily available there. The other thing is just verifying, and I think the commission knows this, is that we haven't approved and done any planning past 27-28. That's why you have a dip in expenditure, except for some of the core things like the media campaigns, things that have already been approved through 27-28. So the dip is there because there hasn't been anything additional beyond 27-28. As we are actually finalizing our strategic plan, and there's an opportunity there. And the last time I know that the interest rate kind of placeholder has been brought up in the past, and that's just the number, remind me, Director Thomas, is just the number that we use just as a very conservative estimate.
It's a conservative estimate. It's not a big, I mean, this year, you'll see when I present in January, we had a big spike in the interest revenue. But typically it's like $1 million or a little over $1 million, so it's not really that relevant that we just kind of keep it low and straight across the board. Usually like when we update the projections for January, we kind of have a feel of what the revenue looks like for interest, that we'll adjust it at that point, but we just carry it forward.
And this past year, it was oddly high.
It was oddly high.
So this is an average based off, actually the last year was also oddly, unusually high.
Yeah, but not, yeah, nothing like, yeah, 23, 24. When I presented in January,
It's
it
extremely.
was almost double.
Yeah.
So.
So it's a low estimate, but also based off, kind of the averaging, but fairly low estimate of what our return.
Thank you so much. Any other comment from the commission? Okay, thank you very much. Appreciate the report. It was, very helpful as always to hear, get that sense. Appreciate your slides as well. We'll move on to item number 5, unfinished business. This is the state and federal budget and legislative update. I'd like to welcome Public Policy Advisory Committee, which includes Commissioner Bernardino Bobby and Commissioner Vivian Velasco Paz to provide their reports, as well as Jorge De La Cruz, who is our First 5 Deputy Director of External and Governmental Affairs. Welcome. To present an overview of the current budget and legislative activities. I'll defer to Advisory Committee Chair Bobby.
So on October 2nd, 2024, the Public Policy Advisory Committee met and received legislative updates, state budget update, and federal budget update. And legislative update consisted of explaining how our legislative agenda was firmly aligned with First 5 California's North Star on audacious goal, ensuring our advocacy efforts focused on key policy initiatives that support the well-being of California's youngest residents. Some of the bills related to the North Star and audacious goals discussed were AB 1895, AB 2319, SB 1112, AB 1967, and SB 1126. In the update on the 2024 state budget, the commissioners were informed that the Budget Act of 2024 allocates $211.5 billion from the general fund, 86.4 billion from other state funds, and 153 billion from federal funds. This budget successfully balanced the projected deficits for both 2024 to 2025 and 2025 to 2026 fiscal years. While there were some cuts to Health and Human Services program, the legislator was able to preserve funding for several critical initiatives. Updates were provided on relevant federal budget and policy matters that could impact our initiatives and ongoing efforts at the First 5 California. Updates were provided regarding future impact legislation, specifically about AB 3218 and how it could impact First 5's financially. So the committee approved the informational items that were presented. Jorge De La Cruz will present the items and answer any questions you have.
Thank you, Commissioner. Hello, Commissioners. How are you? What a day, huh? What a day. So today we're going to talk about the legislative update, the state budget update, and the federal budget update. I'm going to keep it as brief as I can because of the time constraint. Next slide. Next slide. So we went ahead and focused on this past year on supporting bills that focus on our North Star and audacious goal, and that means that we were looking at bills regarding ACEs, childcare and development, education, healthcare. Second, my vision is absolutely horrible. Social services and welfare, infrastructure and public services, equity and inclusion, and regulatory and legal matters. Next slide. Some of the highest priority bills, I'm going to go ahead and focus on in this presentation. Next slide, include some of the bills that we supported directly connected to our North Star and audacious goal. In your attachments, you actually have the complete list of all the bills that we either monitor, supported in any shape or form. But these are the ones that are, again, directly connected to our North Star. AB 1895 with Weber and Wilson, AB 2319 with Wilson, and these, not only do we support them by saying, yes, we support them, or by showing up and giving them me too, we actually went ahead and wanted to build relationships with these lawmakers. So we actually met with them, sat down, heard what their bill was about, and expressed how we are here to help and inform them in whatever we can do to support your bill beyond just, again, just a letter or whatever it may be. First 5 California is here to do just that. Because again, it's about building relationships and it's about showing our support for these measures. Next slide. We also supported SB 1112 with Senator Menjivar and AB 1967 with Assemblymember Jackson. Same ordeal, we met with the lawmakers and expressed our support. Now, some of these bills that did pass and were chaptered, some of them were vetoed, and some of them unfortunately, did not make it this round. But that does not mean again that, we're not gonna not support them moving forward. If it has to do with our North Star and audacious goal, that's exactly what we're going to be doing. And at our next commission meeting, I'll be presenting how our agenda is going to look like moving forward. Next slide. Oh, two more bills, and these did pass, and I really want to congratulate my colleague Alex here, who tackled this effort directly prior to my arrival, which were SB 1090 and AB 2123, directly having to do with paid family leave. Again, both of those passed, and great effort, great workout. Next slide. Now, we talked about the infamous AB 3218. Next slide. And that is the future impact bill that we monitored. And the bill establishes an unflavored tobacco list, or UTL, to enforce regulations around tobacco products that lack a characterizing flavor, which are still subject to sales restrictions. And under this bill, the Attorney General shall, by no later than December 31st, 2025, establish and maintain on the Attorney General's internet website a list of tobacco product brand styles that lack a characterizing flavor as defined. And it introduces civil penalties for distributors or retailers selling tobacco products not on the UTL. This bill is part of an ongoing effort to regulate flavored and unflavored tobacco products, ensuring stricter oversight and compliance. Now, we were just monitoring this bill. We didn't support nor oppose it, but we monitored it because of the potential future impact. And like my colleague Marcia was saying, we won't know until after, a year from January 1st, 2025, the actual impact that it'll have. But based on predictions from the California Department of Tax and Fee Administration, we're looking at about $130 million plus in cuts. And that's available on their website. I can share those links. But that's what again, just an estimate. We won't know actual figures or how it's going to impact First Five until after a year from January 1st. But we thought it would be very important to highlight this because it will affect, or it could potentially affect First Fives, not just at the state level, but county level as well. Next slide. Now, budget update. Next slide. This year, we had a couple strategies regarding the budget. As we all know, we just got finalized, quote unquote. And some of our strategies were to resist cuts and maintain existing funding and avoid the sweep of funds. Consisted of working closely with the administration, pro temp, and speaker. We wrote letters of support, testified in support of bills, and we participated in the Happiness and Public Policy Committees. Dr. Martha Dominguez did a great job at that. So we were actively participating again with the Assembly and senators and having those conversations to build relationship and showcase our support. Some of the champions that regarding our North Star and audacious goal this year that we had conversations with consist of Assemblymember Wilson, Assemblymember Weber, Assemblymember Jackson, Assemblymember Edgar Curry, Assemblymember Baines, Senator Menjivar, and Senator Shakespeare. Again, because we had conversations and they are interested in the audacious goal of North Star and the bills that we're going to be supporting around. But for the budget, just like the Commissioner mentioned, the Budget Act of 2024 allocates $211.5 billion in general fund spending with an additional $86.4 billion from other state funds and $153 billion from federal funds. For timing purposes, I'm not going to go over all of that, but you guys have it in front of you. But I am happy to report that regarding childcare, the main revision postponed a $550 million investment in the California preschool, transitional TK, and full day facilities grant program, leading to a revenue increase of $489 million in 2024-2025 and $951 million in 2025-2026. And it delayed a $10 million allocation for the preschool tuition grant program. The budget now includes the following childcare investments: childcare expansion, funding, restoration of funds, and preschool program eligibility. With health and human services, it includes funding to implement 0 to 5 continuous Medi-Cal eligibility effective January 1st, 2026. A note about that is, this is all as it is, as it stands now. The commission may have some items switch out, just like Medi-Cal, like Prop 35 of this. But if it passes, then this goes away because that proposition would take care of Medi-Cal related items. Just this up. Federal update. So we are also monitoring federal matters that may affect us at the state level, or at the state level, we could potentially be influenced at the federal level. A quick update regarding our conversations at the federal level regarding Congress. Congress is currently in recess, as we all know, with members campaigning until Election Day. The post-election lame duck session will prioritize finalizing the fiscal year 2025 appropriations, with key items being considered, including health care reforms. Regarding child tax credit, a small group of senators blocked the bipartisan tax relief for American Families and Workers Act of 2024, which aimed to expand the child tax credit. Childcare crisis is not just at the state level, as we mentioned earlier, but at the federal level, and depending on the election results, it will be a topic of discussion again at the federal level. Chairs of various Democratic caucuses highlighted the urgent need for childcare funding following the expiration of American Rescue Plan childcare funds. And the key message to that is that childcare is critical for child development, workforce participation, and economic stability, yet remains unaffordable, underfunded, and inaccessible for many families, disproportionately affecting families and communities of color. Now, regarding the Senate Appropriations Committee for the fiscal year 2025, Early Childhood Education, ECE funding. There will be, the Senate Appropriations Committee proposed $2.3 billion increase in childcare and early learning funding over the fiscal year 2024 levels, supporting families and bolstering the ECE workforce, which includes $10.35 billion for childcare development and $12.97 billion for Head Start, which is a $700 million increase from last fiscal year. Now with the House Appropriations Committee, they're proposing a $24.6 billion cut, or 11%, to the Labor, Health, and Human Services and Education budget for fiscal year 2025, contrasting sharply with Senate priorities. So they're looking at things very differently. Again, after the election, we'll have a more clear understanding of what's going to happen at the federal level. And that is my report for you guys.
Thank you very much, appreciate it. Why don't we take any public comment and we'll come back to any commission comments. Is there any member of the public that we should speak on this matter? Anyone online?
No.
Terrific. Don't leave in case you have questions. Any commissioner comments or questions?
Thank you for the report. Thank you for your advocacy and for First Five and ensuring that its services are met for citizens.
Thank you.
I did want to point out, thank you very much. There is a bill to watch. It's, I think, on the suspension calendar, but it will be brought up again. It's AB 1799, child abuse reporting, and it specifically focuses on understanding the definition of neglect, which is going to absolutely impact the children and families that First Five supports. I know several CAPCs that are here, Communities Preventing Council that are here. So just something to keep an eye on as we go forward in terms of the legislation to follow.
Thank you, Commissioner.
Thank you. Okay, thank you very much. Moving on to our last item on the agenda. Item number 6, am I right? It's the last item on the agenda. Small population county stabilization funding. This is an information item. And I'd like to welcome the Program and Evaluations Advisory Committee, which includes Commissioners Majors and Commissioner Rizzo, to provide their report out, as well as Dr. Martha Dominguez Brinkley, First Five California Deputy Director of Program Innovation and Evaluation, to update the Commission on the small population county augmentation and a process for developing the framework for the next round of funding. I'll defer to Commissioner Majors on this.
I'm sorry, you guys, my voice is gone.
Commissioner, or Commissioner Majors, tell us what you want.
Can anyone else report out on it?
Yes, yes. Commissioner Rizzo will report on if that's okay with you, Commissioner Major.
Thank you.
Thinking of you.
We met on Monday, October 7th, so we went over the role of advisory based on a conversation with the AG's office. We updated the program and evaluation operations. We were introduced to Dr. Fabian. Key efforts, the First Five California Forum site visits. We went over home visiting, impact, small county amendments. And we went over the presentation that we're getting today on small population county funding augmentation. So sounds like a little bit, but there was a lot of information that's embedded and a lot of things in that. So I'm gonna hand it over to Dr. Dominguez.
Thank you. Good afternoon. Thank you for having me to share this information item that will lead to county engagement that will later lead to an action item in January of 2025. My presentation will have 3 parts. I will give you an update of the current grants that are in place that the commission approved for 4 years. And then I'll talk about the process that will inform the next funding cycle. And then third but not least, Nicole from Mora came all the way from Mora and came to Sacramento to do a showcase of what they do in Mora and a collective impact approach. So I really want to thank her for driving down. I appreciate her. So with that, we'll kick it off. Next slide. Just to kind of ground all of us, because it's really important as we've been talking about different words and different adjectives and nouns and so forth of how we're trying to restructure First Five, given Director Thomas's report, but also Director De La Cruz's report on all these efforts, how we're all coming together. We need to make sure that in everything that we do, we leverage all the system levers, but also to, most importantly, that we really practice and operationalize a result-based accountability framework, really to ensure that allows us to lead to a North Star with some tangible outcomes. So I just want to put that in place. I know we talk about that, but I want to also walk you through how we've been infusing it in the practice that I have now with the PI division. Next slide. I really love Commissioner Majors challenging all of us in different ways, but the words impact, return on investment, diversity, equity, and inclusion are really top of mind, not only in the internal part of business, but also in the external part of business. So everything that we're doing, I'm constantly looking at that because that also aligns with the result-based accountability. So just putting that at the forefront for us to just be mindful, but part of all that is quality assurance and improvement, because we need to make sure that everything that we do, every dollar that's spent, not only is fiscally responsible, but it really has those tangible outcomes to meet that North Star. Next slide. So update on small populations county funding augmentation. I think for the most of you, some of you have been around in the commission board to know what it is, but some of us have been introduced to this in the last year or so. But essentially, this type of grant funding to small county population is really to help them offset some funding that they already get from directly from their 80%, but really those that have low birth rates. A lot of the small counties are super creative in how they use the funds. A lot of them use it for administrative operations. A lot of them just are able to break different funding. But the core of the granting for these small counties is really to help them, give them an extra boost in their efforts as they serve children and families. Next slide. Just to ground us too, we all know that California is also doing a good job in public health and reproductive health. We're informing families and children and teens of how to have safe sex, but also tying their pregnancy. So therefore, babies are being born less. And there's no surprise that in the last couple of years, birth rates have gone down. So just that's the big picture at a statewide level. Next slide. And
Although if I could interject, you do want to see what happened after we went into shelter in place, right?
Yes. We can talk about that if you want.
Jokes, sorry.
Yeah, I think we've talked about that before, but I'm very aware of that. Next slide. In small counties, the birth rates have also just fluctuated, especially in 2020, and then there was a slight tick on 2021 related to COVID, and we did see that across the board in most counties, just with live births and then now that people are back to quote unquote normal routines and life and work and hybrid spaces, birth rates have gone down. But this is a snapshot from 2022. 7,491 babies are born in small counties, and all 21 as defined by First Five. Next slide. I also wanted to kind of really make sure that we also think about children 0 to 5 that live in small counties. So this is something that we've been really mindful, just to understand the level of volume that small counties serve when it comes to not just live births, but 0 to 5 families. We understand there's different types of generations within the same household, but also we did a breakdown of race and ethnicity, and you can see that Hispanic, multicultural, and white are the primary race and ethnicity in the small counties. Next slide. The current SBCFA structure has been that from 2017 to 2021, there was 20 counties. In 2021, Mendocino was added. We do intend to move forward with the same 21 counties as we move forward, but there was a different type of formula because there was a different time and place and even resources that was utilized to inform the funding structure. So this is really to kind of give you just a really context of the different structures that has been and how funding even was released. At one point, they had 1 or 2 waves of how funds were being released. Currently, we do quarterly invoicing and through the structure. So I think the big takeaway here is now there's 21 small counties. We want to work in that direction, but we do need to look at the funding structure as we move forward, especially the funding formula. Next slide. Currently, this is on the past, I've shared this before, since 1999 to 2000, funding on average has been about 200,000 per county per state fiscal year. And the current structure, the 4.25 years from April 1st of 2021, that will sunset in June 30th of 2025. There was a allocation of over $18 million that has already been allocated. We are at the tail end of that. We've been working really hard with all the amendments, allowing the counties to roll in their funds. So the 1-year extension, that's the current period that we're on now. So that's also to process-wise. Just for those of us that are new, this is why we needed to do this process, to do the information, so we can have the kickoff, and then we don't we don't want to have a break in services or in grant periods. So it's really important for us to continue this process. Next slide. Couple of things I do want to make sure that you guys are all aware of some key efforts that we've done with the small county since I came into the First Five family back in fall of 2023. I established a corrective action plan. There was an assessment, and then in regards to quality assurance and improvement, there was some challenges that we had. There were some communication issues that we needed to improve. There were some programmatic oversights, operations, staff support, and also technical assistance grants. So we heard the counties loud and clear. They needed to get paid. We needed to get invoices. We needed to get emails responded. So we made some shifts here at First Five as well to make sure that we had the best possible team to be responsive to that. And then in the winter of 2023, that corrective action plan continued to ensure that invoices and folks were getting paid. And there were certain processes that we needed to reconcile budgets and do those change requests. And we also had a couple of multiple listening sessions that really underscore even streamlining the reporting, like the annual progress report. We essentially eliminated that and we allowed that to include on the annual report so they can just report all at one time. We recognize that the small counties wear multiple hats, so we wanted to make this as easy as possible. So October 31st is the deadline for that annual report, but it's also the time that small counties will be submitting their information. So the timing of us getting the data will be really important because that will inform the next funding cycle. Some have asked for some extension, and that extension will be until December 7th. But that December 7th is super critical for us to get that data too, because not only for the big picture of the organization and the annual report, because we do have a legislative timeframe that is non-negotiable. We need to report in January, but also too, this will inform the next funding cycle. So I just want to inform that all these dates really do matter to inform our practices as we move forward. So just want to give you a snapshot. These are, it may seem very succinct, but it wasn't. We had a lot of good conversations and a lot of folks, we hope that we also just develop overall a better relationship, a better customer service, but overall making sure that they have the resources so they can serve their communities in their areas. Next slide. Director Wong mentioned to you guys, site visits, it's a public health practice because we want to make sure not only just go out to the sites to learn what they're doing, but also just to kind of see the infrastructure, the apparatus that is in the community. Nina Machado is amazing in Amador, and it really showed us how she's working with the Native American businesses. They provide a building for her. She has public health down the street. Fathers and parents come on Friday mornings. They're there helping their children. She also has nurse interns that come and help her and are able to provide services. That she has social workers on hand. It was just a really nice collective impact approach that I know a lot of the other small counties also emulate. But this was just a really nice experience for us with Amador, but also for our team, for my team, for the PI, just for team building. We were able to go next door to Sutter County to have lunch. So that just allowed us to just be experiencing in the environment and just be in that space to understand what the EDs are experiencing in certain moments. Next slide. So the next First Five is the process of the next funding. So First Five contributes to small counties, and we want to reimagine the process moving forward from augmentation to stabilization. So let me tell you why. Next slide. So for 25 years, First Five has offered limited term grants to address funding issues. So every 3 years, every 4 years, the small counties come to you guys like, hey, we need the money. We need it for X, Y, and Z. And it's the same kind of sort of cycle. What First Five is committed to is moving from that limited term grant funding and seeking to provide consistent funding on a long-term commitment. We recognize that small counties have competing priorities, have limited resources, so we want to commit to the small counties for a longer term. That means that the grants may be still in a 3-year cycle, but we want to make sure that they understand that we're committed to funding them as long as funding is available. For the most part, I think First Five has done that, but I think the funding has fluctuated on the amounts of resources that there is available. But that's a shift on our commitment, and I think Director Juan has mentioned this in a couple of meetings, but we just want to come forward to make sure that the small counties understand that First Five is committed to you guys, but we're also committed to making sure that you have that long-term funding so they can plan for different periods of funding cycles. Why? Because we want to make sure that we can also operationalize their efforts to have tangible outcomes, to have performance measures and metrics. I know some of you guys are very intentional on asking us about outcomes. We want to make sure that we structure that so we can track that. So if we don't track that, unfortunately, we won't know if we're moving the needle or not. We need to track our efforts. We need to track our investments, and we need to provide that structure and that apparatus to ensure that program is really intentional with the dollars that we do to reach the North Star. Next slide. With that said, some next steps on county engagement. I think all the small county EDs already received an email last night on a couple of listening sessions that we'll have November 6th and 13th. And then I will regroup with the advisory, both fiscal and program, to give them an update and give a recommendation. And then we'll keep having those conversations. And we'll, if needed, we'll have some more in December. But the goal is to come prepared in January for a full action item. Again, this is all based to ensure that we reach that result-based accountability, to ensure that we're tracking everything that we're doing. There's things that we'll also ask the small counties, like the lean reporting, if that worked or not, and we'll have a good conversation with them. They're not shy, so we will appreciate all this feedback. Next slide. Just a couple of key takeaways. I've said this to them. I know Director Wong has said this. Dr. Williams has said this. I think First Five as a whole, we just want to make sure that they understand that we're continuing to partner with them as a whole to ensure that collectively we reach the North Star audacious goal. It may sound as simple, but we also recognize that we need to make sure that there's funding opportunities, but we also provide quality operations and educations, and we track all those things. We need to have quality improvement consistently. That's not an on or on switch. It has to happen consistently for operations, oversight, and partnerships. We have to take the learnings from one investment to the other. I know that's been a comment that you guys have made to us, so it's taken to heart, and I really do appreciate those comments. And then last but not least, but we're committed to funding small counties through a result-based accountable structure based on revenue availability. So next slide, and I think this is where I introduce. I just think this picture is so beautiful of Nicole. Look at this background. This landscape is so amazing. You don't know where Modoc is. It's up north, up close to the border. But with that said, I will introduce Nicole.
Good afternoon, First Five California Commission. I do have handouts for you. These are the handouts that are given to any person that walks into our front office lobby area, which is located at the Modoc Joint Unified School District. This handout includes general information about our hub, which I'll talk briefly about. Hollywood Imagination Library, our recent hire, our community health worker, who does everything child health related. And then also our parent powered text program. So again, my name is Nicole Hinton. I'm the executive director of Modoc. And we're also known as the First Five Modoc County Children and Families Commission. This is going to be a county overview. Next slide, please. Oh, sorry, after the title slide. Got to switch over to yours.
Give me 1 moment, sorry about that.
You're good. Maybe Chair, how long did it take you to get here? It takes about 6.5 hours, and I stay with friends in Auburn to save money for. Been doing that for years. Yeah. So I'll talk while we get to the introduction slide. So the ideals and principles of First Five Modoc focus on systems change approach to ensure inclusive governance, which encompasses diverse perspectives, including those parents, families, caregivers, and partners, not just locally, but regionally and at the state. This presentation today is going to be a very brief overview of some of our investments, as well as our work since 2000. I think it's something to keep in mind. I came to First 5 MODOC in July 1 of 2018. And of course, these investments aim to improve access to early childhood systems, services, and resources, focusing on 4 specific priority areas. Much like your guys' North Star, next slide. Those include improved child health, improved child development, improved family functioning, and systems of care, which I affectionately call systems of change. We've always called that in our strategic plan. But of course, these were created prior to me really starting. It was actually when I first started, I was told you have an audit and you have a strategic plan to do. So that's what we did. And so next slide, please. To give you an idea of Modoc County, that is where the West still lives. That is our motto. It's been our motto since I was a little kid. I came to Modoc County from Mariposa when I was 4 years old. The population is 8,500 according to the census. Our 0 to 5 population is approximately 567 kids. I could probably name every single one of them. Our square miles is 4,200. That is 2 states of Delaware put together. We are the 3rd least populous county in California. As you will notice, our median income is almost half that of the median income of California families. Our poverty rate is 16.9%. Next slide, please. A little bit of background about us. We now provide direct and indirect services to children birth through 5 and their families. Programs are implemented in partnership with local organizations seeking to provide equitable access to services for culturally, ethnically, and linguistically diverse communities. Of course, you know the history of all First 5s, and that this tax-based funding seeks to promote, support, and improve early child development of children birth through 5. Specifically for us, the small county augmentation funds have really provided a fiscal floor for us and have allowed our agency to provide these services since the early 2000s as a backbone to really look at collective impact. Next slide, please. So here we have a few photos. Since inception, originally, not since 2000, we have invested $7.9 million into local programs and projects. We have Assemblywoman Daly here reading to the children in our playroom, which was created in 2020. Our child development since 2000, we have invested $2.75 million. In health, we've invested $395,000. Family functioning, $1.02 million. Systems of change is $679,000. There has been a 10% increase by our commission into systems change since 2007. And I think that's something to really think about when I talk. What we've done is we've moved from a grant or grantee model to a collective systems change model. We are no longer a piggy bank. We do not look at things as you're going to come to us, you're going to have an ask. We look at things of how is this affecting all children and all families? We have really big conversations with those families, with those providers and those partners to invest in target investments. And also, what do I see as a trend and what's going on at a region and state level? Next slide, please. So 2 years after being with First 5 MODOC in January of 2020, the commission recognized the community-wide need for an open door direct service model to really provide centralized access for resource connection. We're talking diapers, wipes, all the things that we never really had as a community. You'll see my kids are down here in the bottom. This is when they're much littler, helping me at our local park hand out things. Also the need for community events, education around parenting, provider care, family engagement, funding leveraging in a way that we had never thought possible, and community advocacy. Also, the continuous systems investment is called for us the First 5 MODOC Early and Learning Resource Hub. The hub provides access to all families and providers of children aged prenatal through 5, again, through outreach, partnership, and educational activities. Next slide, please. Here is our systems change model. This was created when I actually finished college. I finished college through First Five MODOC. And so the hub acts as our primary connector. It is a connector to all systems serving all children and families in Modoc County. And we really want it to support a seamless infrastructure of care. Throughout the year, the hub provides, again, community engagement activities and events, and really looks at investing in projects and programs that promote the understanding and importance of early childhood and family development. All of this is done in collaboration with agencies and service providers to create a seamless and comprehensive system of early prevention and intervention for children and families in Modoc County. I'm going to stress to you, I was the only staff person until 2022. So we just now have, we had a part-time staff person for 2 years. We now have a full-time staff person. Modoc County cannot continue these efforts. Next slide, please. Without the funding of First Five California. These are some of the kids that we serve. Our collective impact relies on the collaboration of all counties. And I really urge the State Commission to provide SPCFA funding as an allocation rather than a grant, as the current grant model really does hinder the progress of small counties. If this recommendation is not feasible, I do urge the State Commission to treat SPCFA as a core operating support to catalyze collective impact as we've been able to do. I urge you to provide funds in advance rather than arrears, as the latter creates financial stress for counties. We luckily have not been in that situation, but I do know others in the 21 smalls that have. We do urge you to accept annual audits and evaluation reports to reduce the administrative burden on small counties. I want to thank Martha for including in the annual report and First Five California staff some reporting metrics, but it would be nice to have it further added. And I also urge the recommitment of SPCFA for multiple years, has been talked today, to ensure a more predictable funding baseline. Next slide, please. The impact of a small county extends beyond its borders. Together as 21 small counties and in collaboration with our mid and large sized counties, we form a network of 58 strong, effectively serving all of California's children. These are the projects that we're currently working on right now. We have a Welcome Baby program that we've adapted from LA's old Welcome Baby program. It supports 6 visits from pregnancy until 9 months. Our community health worker is finishing up her CLC certification for breastfeeding and lactation support through UC San Diego. Of course, we have our supports through the community health worker. We're working with Partnership Health Plan. Thank you to our awesome partners in Sonoma and the rest of the region to get CalAIM going and community health work and all that good stuff. Also, I am the lead and coach for all the sites at Modoc County. So every family child care provider and every state preschool teacher, I get to see them. And then the other part is we're really working hard on developmental screeners, and that's something my community health worker asked me to uplift. We have a vision screener and a hearing screener that we borrow from our Head Start partners to do those things in collaboration with public health, as well as we are now working on ARPU, ACEs, benevolency, and other screeners. So again, I just want to thank you for your time and really appreciate the state commission's just dedication to all children within California and all the families. So again, thank you for your time. If you're ever in Modoc County, please stop and visit me. My office is located in Alturas, right behind the high school.
Thank you so much.
Thank you.
I have one question, just as a point of clarification. And I was looking through the deck, so I don't know who this goes to. You said the difference between an allocation versus a grant. Can you talk a little bit more?
So when I first started, SPCFA was an allocation. We would get so much money up front, and then at the end of the year, we'd have a giant balance left, and that's what we anticipated getting in the end. That was the first, maybe into the second year that I started with First Five MODOC. And then it did change to more of a grant-based system, which is really hard. I wear all hats. I'm the fiscal person, the communications director, every hat. And so it's really tough. This is the first time in 25 years that we've asked for an extension for our audit and also for our annual report. We will have it by December 7th, but the onus is astronomical when you're talking about a small county. I meet with R&R, I meet with public health, behavioral health, early head start, all the 0 to 5 spectrums, lives with the first 5, because we have the heart for it. We're the ones that sit at the table and say, have you thought about the kids? Okay, great that you thought about the kids. Now did we think about the tribal communities and those families? Okay, we thought about those. What is the promotories doing? We're always asking those reflectionary questions because we are you guys. We're speaking for every single county when we go into those rooms.
And so now it's going back to an allocation?
I don't know.
That's what I mean.
That is
A
what,
request.
That's a
a
request.
request.
Got it.
And
Okay.
so there was a shift, and I think we talked about in January as well, so staff will help fill in, is that the allocation, deemed at the time, actually, Ruth Frank looked at it and said the allocation was not in compliance with our statutory authority. But then we went into contracting, which was not great. Everybody will remember with the contracting, which is DGS, and it requires our, our control agencies, which took forever. So that didn't work, and so then we said, then our new legal counsel at the time, Marcia Bedwell, said that, okay, this is reading the statute, we can actually grant directly without going to a control agency. And so we are in a grant allocation and sell situation. That doesn't preclude the ability for us to promote some dollars, which we have been talking about a little bit, but that is, it will probably remain a grant because nobody wants to do contracts. And I don't hear a desire to go back to contract. I'm seeing no, then no contracting, no DGS, no like waiting for us to talk with staff. You guys want contracting? I hear no.
So in terms of the challenge with the structure as a grant, what are the challenge? So I'm hearing when the dollars arrive, but there's more
Often,
reporting.
the nimbleness of a small county is dealing with something that arises. And the way that we've been having to deal with this for 4.25 years, I believe it is we've had to say, okay, well, here's our budget, we anticipate X. Well, that's really hard when it comes to a systems change budget, right? Because things change on a dime. And in a small county, it's very quick on a dime. So often I can't even use SPCFA dollars to do that actual work. It's other money. It's unrestricted funds, it's stuff I'm getting from MHSA, other contracts that I'm actually doing that work with, and probably not the SPCFA dollars, which would really do good work. We can use those more nimbly.
Thank you.
You're welcome. Thank you guys again for your time.
Thank you so much for the presentation. Where are we? Why don't we take any public comment on that? How many members of the public? Like 1, 2, 3, Ava, 4. How many members online?
1.
5. Okay, why don't we do 2 minutes? 2 minutes.
Thank you, Chair Albright, and Commissioner Macdessian with the association. Just want to thank staff for highlighting the importance of SPCFA and for some time for Nicole to present what's happening in MODOC and the great work that she's leading. We haven't had the chance to digest all this new information yet, so we're doing it a little bit real time. But I want to emphasize one thing is that SPCFA is, as Nicole said, foundational funding for 21 small counties. It is meant to correct a flaw in the Proposition 10 law. It is literally the foundation of funding that other counties get through their 80% allocation. It is trying to make up for that flaw in the law. And so when we see the word stabilization attached to SPCFA, some questions go off around whether this is stabilizing the foundation. What I'm here to tell you is SPCFA is the foundation. It's not about stabilizing, it is actually the foundation. Nicole and other counties can't even turn the lights on, let alone hire staff or do programming without SPCFA. So about a year ago in November, the SPCFA work group and 20 counties signed a letter with recommendations on how to make SPCFA more equitable, more efficient, and more effective. And top of the list was make SPCFA into an allocation And at a minimum, take off all the strings of measurement, performance, RBA. We get it. Counties get it. They are public agencies. They are stewards of public funds. But what happens when you put more requirements and call something a grant program, you're essentially putting more burden on the counties that have the least capacity. So this isn't easy. This is the easiest and most equitable investment this commission can make. And the association is standing pat, ready to hire any lawyers we need to, including our own lawyer who drafted Proposition 10, to say this can be done this way.
Thank you. Next speaker.
Smith Vaughn, Executive Director for Spike Lake. I want to thank Martha for the work that she's been doing with her team around trying to correct some actions that were done. We have a long way to go. As Avo had alluded to, there was a lot of conversations and a lot of asks. One of the biggest asks that we had was a timeline. We need a timeline as to when we can have these longer discussions, when we can have these conversations around our needs and our flexibilities, so that we can appropriately and effectively have these conversations. And to see this on the agenda without being told by the commission or by staff that this was going to be on the commission agenda was kind of disheartening. We had to find out by looking at the agenda and by having one commission ask. All of the 21 counties operate very differently, very independently from one another. We do also operate very collectively and collaboratively, I like that word in those terms, because we can't function if we don't. So that is something that's naturally built into what we do. We don't always get to work extensively outside. Coming to Sacramento is a hardship for some of us. It's very difficult, and we're not always able to come. Some of us couldn't go to San Diego one, would have loved to have been there as well. So just as a reminder, like, we are small, but we are mighty in our communities. One of the things I also want to just kind of highlight, I know that Martha had brought up the data around race and race equity within our communities. It is still a practice today for many of us who have a lot of Native representatives within our communities, for them to write white on their census. It is a practice that they continue to do. And so that is an inflated number of the white individuals in our community. So we do have a lot more diversity and equity within ours. And we also have a lot of poverty within our communities. So we are a very equitable investment. And I hope that you do continue to invest us. And I do love the idea of having this continued investment where we know, I'll wrap up my sentence, what where we're going to be and where we can actually sit and stand and how we can support our communities. Thank you.
Thank you. Next speaker.
I will say, with first with Messina, just to echo again what everybody said already about the equity investment. And I just want to just, put this also into the language of the statute was written with an urban bias with that population, that birth population. And so SBCMA funds were identified as being, being seen, since the rural smaller counties do not have the same resources available to kind of fill that gap. So I just encourage, again, the commission to fund it as an allocation that continues the commitment towards achieving this equitable access to resources, while also collaborating with the association to co-create a stabilization fund. I think keeping the word augmentation or allocation and not diluting stabilization, because that there is stabilization and needed across all 58 counties. Thank you.
Thank you. Next speaker.
Good afternoon again, Mary Ann Hansen, First Five Humboldt. First Five Humboldt is not a small county. We're a smallish, but not small, so I want to make that distinction. I want to begin by commending you for recognizing Nicole's fantastic work. She inspires me all the time, every day. But I also feel like, as her colleague, I need to point out that her phenomenal work and success comes at great personal sacrifice. Mm-hmm. She follows in the footsteps of decades of child care providers who work more hours than they're paid at a lower rate then reflects the complexity and the intensity of their work. And she does it, and all our small county EDs that I work with anyways do it because of their passion and their commitment to their communities. And so I think it's important not to say to small counties, you have to achieve at this level, if they're not, when they're dealing with so many barriers, right? So to understand that that's very different and that it comes with sacrifice. So my core concern, however, is the renaming of the augmentation fund to stabilization, which feels like this could possibly, it could be perceived by your interest holders as a way to obfuscate opposition to the First Five Association Stabilization Fund proposal. If I'm blunt, it feels like it could be used as a strategy to respond to policymakers who are questioning First Five California's efforts to address stabilization. It could become a well-packaged response. Oh no, we just approved a stabilization plan, without while obscuring the fact that this is actually just a continuation of a correction to an error or a lack in the original policy and statute. So which did not really understand the complexity. So I urge you to continue your support of small counties in a streamlined process with as few barriers as possible for small counties.
Thank you.
Hi, good afternoon. I'm Amy Broadhurst, Executive Director at First Five Alpine, the smallest populated county in California. And I just want to echo all that has been shared by my partners here in other counties and small counties, and really thinking about that funding as being a flaw in the law, not be something to stabilize. In First Five Alpine, we do use that SBCFA funding as all of the operations. I do all of those pieces in the fiscal part, the administrative part, and also the direct services with assessments and so thank you.
Thank you. Any other member of the public in the room? Any member on the phone?
Yes, Fabiola Gonzalez.
Hello, can you hear me? Fabiola Gonzalez, I serve as the executive director here in First Five Fresno County. Hi, everyone. I also serve as the president for this year, for the last couple of years. No, this year. This is my first year as the president of the First Five Association. I'm sorry I couldn't be there today. I'm actually, my commission just approved annual report and audit reports as required by statute. So you know why I was back home. But I wanted to stress and support for my colleagues that have spoken to you in person. I want to underline what Marianne Hansen mentioned in terms of the wording used, when you have a stabilization there and how it could be perceived. So I'm hopeful that I'm adding more of your eyes, more of your thinking on how this may come across. But most importantly, I want to stress that this is a flaw in Prop 10, and you've heard that a couple of times. And so Fresno is not a small county, but we recognize that when you're asking more requirements, more reporting on top of a state annual report and audit reports that all of us have to already do, then it feels very unfair and unequitable for our smallest counties to think of this as grant dollars that they need to be reporting on in order to be reimbursed. So I'm hoping that you just sit with that for a little bit longer. I understand that some of these counties in Proposition 10 alone only get about $13,000 annually. And I think I heard a little bit of the fiscal presentation earlier, where you all know that every month we get an allocation. Everybody waits for that email from Director Thomas where she shares how much money has been deposited for every county. So imagine $13,000 annually, you can't do anything with it. So if the average more or less is about $180,000, $200,000 or so that come in through this SPCFA dollars, that's where you can hire staff. That's where you could do work. And Another thought is if this is a grant, imagine folks can't count on any dollars left over to use for the next fiscal year. They have to report what they spent so that First Light California reimburses them. So that is not the way that you want a fiscal floor. Like that's not a fiscal floor, right? They need to operate in a way that they could count on how can they continue doing the best work that they can. And I want to say hats off and kudos to Nicole, who despite all of these challenges, she just shared with you how she's very mindful of systems change work with like a population of 500 kids. And she says she can name them all, but she's still mindful of like, regardless of direct services, I need to figure out a way that I can connect with other systems in my community to respond to the needs. And so I ask you to really, as Martha mentioned earlier, that you're reimagining how to do this differently. I ask you to consider this idea of wrestling with your councils, with whoever you can, to figure out a way that this is easier, simpler for small counties so that they don't have to feel it like a grant and they have to request reimbursement for work that needs to happen. Thank you.
Thank you.
Melody Easton.
Melody Easton, thank you. And our time is 2 minutes per speaker. Thank you very much.
Got it. Thank you. And I apologize for having to dash out earlier. I had to leave to pick up a sick kid from school. You've heard from my brilliant colleagues up and down the state. I wanted to just re-elevate something that Nicole shared around the tables that we sit at and the partnerships that we're part of. Just yesterday, Chair Albright, I was with you at the Greater Bay Area CAPC statewide convening, where First Fives were listed a couple of times as key partners in the ongoing work for child abuse prevention councils. We're listed as a key partner in the Families First Prevention Services Act. We're listed as mandatory contractors in the Medi-Cal partnerships. And so all of these things require staff time and energy and people to attend the meetings and be at the tables. And in most of our small counties, that's us. That's the executive directors. That's our very small teams. And this really foundational funding allows us to be there, allows us to think about ongoing sustainability for ourselves and for our funded partners. And so I lift up all of the comments made by my colleagues and urge the commission to continue to look at this funding as key foundational support for our organizations. Thank you.
Thank you. Any other speakers?
No.
Thank you. Any other speakers in the room? Okay, thank you very much. I'll open it up to commission's comments.
I just want to recognize that I completely get the struggle of the rural, the work that you do and with limited resources should be commended, but I heard that loud and clear, and growing up in a similar town, appreciate the work you're doing. It's very important.
Thank you.
I'll just add that I think it's really an opportune time to again reimagine, right? I think the way that we've conducted our business in the past may not be the way that we can do going forward. I love what was shared in terms of looking at it from a collective impact, systems change, connecting all the dots, and really maximizing the limited resources that come to our county, regardless of size. I think that is something we need to be working on. And I hear what you're saying about, it's a small pot of money, additional requirements for one person. Maybe some more of the other 21s also have maybe 1.5, 2 FTEs. And so I do encourage the small counties with staff and the committee, the advisory committee, to really reimagine what the future of this funding could look like. How we frame it, how we label it is really important, and more importantly, how we are able to disperse the funding out so that it's maybe not equal, but more equitable. Some counties are further challenged with resources, and maybe a different allocation methodology should be explored so that it's more equitable distribution of resources to the counties of greatest need.
Thank you, Commissioner Hazen.
Yeah, I agree completely, and really appreciate the feedback from all the small counties and the reminder that at the end of the day, the more we ask you to do in terms of grant writing and reporting and all of the administrative tasks, the less you can do to do the systems change work and drive impact in your communities when we're talking to like about a person, maybe not even an entire person, right? So I really I'm hopeful that the committee will consider these things, and that we can help small counties do the most with these limited dollars, and really support their communities.
Any other comments? Okay, thank you so much. This has been a fantastic meeting and really appreciate it. I love the comments and engagement and what we learned today. So thank you to the team for bringing all of this to bear. We are on our final item, which is adjournment. Our next commission meeting is scheduled for January 30th, 2025. A lot will happen in the next, not a lot will happen in the next, not just week, but in the intervening weeks for that meeting. We have a location. This is okay. Back here. We will most likely be back here. We've had a request to go to Monterey, so we are going to look into that as well and figure that out now that we have our calendar put in place. So more to come on that, and thank you to the team. I also wanted to appreciate Simon for creating the slide literally in the middle of the meeting. Any questions about commission meetings or documents, please submit a letter to the commission. Here is the new website, email governance@ccfc.ca.gov. Please submit any communication to that. It helps us to streamline it. Please also, to the extent you can, create ADA acceptably compliant PowerPoints, et cetera. You can work with Simon directly on that in order to get those guidelines, although I think they're part of anyway, state protocol. I think you can actually Google ADA compliant PowerPoints. Why don't you guys connect? Because it's actually not our requirement. So I want to make sure that the right information and that may update kind of. So with that, is there a motion to adjourn? Is there a second? All in favor? Any opposed? Thank you so much, Commissioner Majors. I hope you feel better. Thank you all so much. Take care. Have a nice safe drive to all your places.